of for citizens with developmental disabilities.
So, what are we going to pick up on? What's our next topic?
We're going to have the presentation from the report from the Office for Citizens with Developmental Disabilities. Give me about 1 more minute. We're meeting back to order. And then we'll proceed with Ms. Julie's. All right, the time is now 1:00 p.m. on January 20th. We're going to call the meeting back to order. For those of you that have returned, please turn your camera on, and that way we can go ahead and begin our meeting. Also, I'm going to ask that you govern yourselves accordingly for whoever's presenting the report, give them the courtesy of allowing them to continue presenting their report before we're able to ask any kind of questions. Just some housekeeping, make sure that you limit your questions to, you have 3 minutes when you're recognized by the chair, whether you're a council member or about a visiting in the chat box, a guest. So at this point, we'll have the next item up for business is report from the Office with Citizens with Developmental Disabilities. Ms. Hagan, we yield the floor to you.
All righty, thanks everybody. I mentioned this a little bit earlier. You guys should have all received ahead of time the report, our report. We did some work on the report. Some of the data that we were presenting seemed to be a little bit confusing and maybe not really accurately addressing information that was relevant. So we did some tweaks. We also identified that some of the language that we were using might have used, some people call it Baton Rouge language. So the language that might be difficult to understand. So we made several tweaks to our report, and I'm presenting it to you today. I'm happy to take any concerns or suggestions for changes today or as people review it. I've always shared my email, julie.hagan, Hagan @la.gov. And if there's information that we don't have in here that would be relevant for people, or if there's information that's confusing, I do ask that you let us know, and we'll be happy, or something that we might have taken out that people would like to see stay in there. We're happy to put it back. But again, our goal was to try to be a little more ease of understanding and have data that was a little more relevant to our current to the current times. So I'll take a little bit more time than usual. I won't read the report, but I'll kind of go through to let you know what we changed. In that first page that you see right now, that data table changed. We used to provide information that said, this is the number of people in waiver this quarter. This is the number of people who've gotten in waiver, over the last year. And it didn't seem that it was useful information. So what we've provided for you here so that people can take a look at the number of waiver participants that we've had. Again, this table shows you over a 3-year period. I'll explain a couple things in the table. So when we say unduplicated paid recipients, the unduplicated part means that there's no one who shows up twice. So in each month, for example, July fiscal year 20, that's the first cell, there were 12,477 individuals who received services. And sometimes we have to do things to make sure we're not counting people twice. So by unduplicated, we just mean that's the total number, and it's not repeated. By paid recipients, that means that we all looked at the number of people who are in our home and community-based waivers who actually had a paid service in that year. So you'll see the numbers fluctuate somewhat. That's as people go in and out of the waivers. And that's also, there may be people who don't necessarily get a paid service within that particular month. And so again, you can now see those total numbers of people by month for the last, 2.5 years. And then we gave you an annual number of individuals that receive a paid service so that you can take a look at that over time. And we have had a little bit of a dip in the total number since fiscal year 20. But it's not a substantial number of individuals. And then the next table that you'll see, we wanted to share with you guys. So one of the things that the DD Council had asked of us in the past was that we share the number of people receiving waivers, because we used to look at, when we were still in a first come, first serve, we looked at the number of waiver slots that we had available. And when we shifted to the tiered waiver process, where we no longer make offers on a first come, first serve, but we make offers on a priority. And so everybody who's a priority 3 or 4, which means that you have urgent or emergent needs, they get a waiver offer. We no longer count slots, but what we do count is our budget, and the budget that we have allocated to us for those services. And one of the things the council has asked in the past is that if we get close to having to reinstitute a waiting list or reinstitute a process where we're not able to make offers to people who have that SUN score of 3 or 4 or have urgent or emergent needs, that we make sure we let the council know so that they need to go, so that they would be able to go back and request additional funding. And so there is a request to keep $1 million in the New Opportunities Waiver Fund, so that if we ever did get close to having to reinstitute a waiting list, we have that funding there. And the commissioner has agreed and has put in writing, Jay Darden, to the council, that he will maintain that $1 million. So what we now watch very closely, instead of looking at the total number of people in waiver, so slots, we now really use our waiver budget to watch and make sure that we're not getting close. And we are not at a point right now where we are near the point of having to reinstitute, where we're not able to make waiver offers to people who are a level 3 or a level 4. And as a reminder, if we ever did have to do that, then we would make offers first to people that are level 4, and then go by the person's protected date on the registry. And that's something that we worked closely with on the council in the past. So you can see here by state fiscal year, and this is a total. And when we say total, that means it includes the state general fund amount that we put up, in addition to the federal match that we get for our home and community-based waivers. So the total amount, and I think I saw a question, this is for all 4 of our OCDD home and community-based waivers. So it's combined for Children's Choice, Supports Waiver, Residential Options Waiver, and New Opportunities Waiver. So the total participants you saw, and then the total payments are for all 4 waivers. So in fiscal year 20, and I think we mentioned this before, but our fiscal year runs July 1. So when you see state fiscal year 20, that would be July 1 of 2019 through June 30th of 2020. On our OCDD waivers, we spent $557 million. In state fiscal year 21, we spent a little less than that. And then right now we're halfway through state fiscal year 22, which runs, started July 1 of 2021, and it'll go through June 30th of 2022. So you can see there, again, we thought that was relevant information for folks to have, to be able to look at what spending is over time, as well as where we are. The next table that we show to you guys is something that we often get asked questions about, and that is the average cost per recipient in our waiver. This is also combined for all 4 of our waivers. And what that tells you is that on average, what the cost is to be able to support a person in our home and community-based waiver. And you can see across the state fiscal years that average is remaining fairly consistent at about $44,000. And so again, what that means is that if you take all of our participants that are receive waiver services and we look at the costs to be able to support those folks, on average, we're spending about $44,000. And again, the rest changes, but around $44,000, a little more than $44,000 a year per waiver participant. And that is the average cost. And I'll go through the report, and then if you have questions, I'm having to dial in from my phone because I'm having a little bit of trouble. So it's a little harder for me to navigate the chat, but if it's okay with you, Chairman, I'll go through the entire report and then take questions. It may be easier that way. Is that okay?
Yes, please proceed.
Okay. So the next piece that we changed was the screening for urgency of need. In the past reports, this was probably the data piece that was most confusing, because when we started reporting out on our screening of urgency of need to the DD Council, it was when we were in the process of trying to screen everyone on our registry. And now that we've gone through the process of screening everyone that we were able to locate and that was willing to participate, because some did not choose to participate in the screening of urgency of need, we felt like it may be more relevant to present the data in a little bit of a different way. And so the information that you see now, there's some lead into that. Again, I won't read, but the data that we're sharing with you now is the total number of screenings that we did in the quarter. And we did present this information before, it's just presented a little bit differently. So what this now tells you is that from October 1st, 2021 to December 31st of 2021, we completed 607 screenings, which is our screening for urgency of need, which is what is the pathway to have a person be offered a waiver opportunity. And then of those 607 screenings that we did, we've given you guys a breakdown of the number of people who fell into the category of having emergent unmet needs, the number who fell into the category of urgent, and then again, critical, planning, or no unmet needs. The other piece that we thought was important for you guys to know is we now, as I said, we've screened everyone that we were able to locate and that was willing to participate. So now we complete screenings really for 2 different reasons. One reason is that we have people every day who newly become eligible for our OCDD services, and they go through the eligibility process and get a statement of approval. Well, as soon as someone gets a statement of approval through the local governing entity, we ask if they want to be considered to be on the registry, which means that either right now or at some point in the future, I might need home and community-based waiver services. And once if they say yes, then we have what we call an initial SUN screening. So that's people who are newly found to be eligible. And then we also have people, if you remember when we shifted from first come, first serve to prioritization, we said, if you don't have urgent or urgent or emergent unmet needs right now, but you might have needs in the future. You just need to ask, and we will come in and do a rescreening. And if you're found to have urgent or emergent unmet needs, then we'll be able to make a waiver offer. So we also now are routinely, so if you had a screening 5 years ago and you had a zero or a one means I don't have unmet needs right now, but I may 5 to 10 years down the road. So we are now starting to do rescreenings just on a regular basis. So we have initials and we have rescreenings. We thought it would be important as well for folks to know how many that we did in the quarter that were initial screenings versus the rescreenings. So you'll see that information there. We're also often asked about early steps. And so we are sharing information about the total number of children that are currently receiving services through our early steps program. So that's a new data piece that we've added as well. The remaining parts of the report are just our summaries, and there are summaries of information that we have included in the past. Again, we just tried to organize it so that it read a little bit differently. And in terms of our waiver, the largest thing that we've been focused on is the post-public health emergency exceptions. And thanks to any of you guys who participated in our work groups, we are in the process of submitting. We've submitted some of our waiver amendments to CMS. The only one outstanding is our new opportunities waiver. And that's only because we're not able to submit it to them until we get approval on our 5-year renewal. But we've posted all those for public comment. We did talk a little more at length in the community inclusion. So I'm happy to take questions, but we are moving forward to make sure that we have changes in our waiver that'll be able to be in place before that public health emergency ends, so that individuals and families will know how to plan. That in the last quarter, that was our biggest focus. And in the report, we've also included for you guys sort of a breakdown of what happened in those focus groups and what those changes ultimately were. I've also we had some questions about the American Rescue Plan Act earlier. My report includes a summary of the things that we've asked for in OCDD. And then as a reminder, we do not have CMS approval on those. As soon as we do have CMS approval, we'll be moving forward with requesting those activities that are approved. We were really excited that the federal government decided to continue the My Place or Money Follows the Person grant. So we now, we had previously had information in the report that had slowed down because there was uncertainty about the funding, but we are full force back working on what we call My Place Louisiana and activities for Money Follows the Person, which is really exciting because some of the conversations you guys were having earlier about people needing additional help to leave group homes or facilities, whether that be nursing homes or group homes, and to keep people, out of those facilities. Our My Place Money Follows the Person grant is really a critical component to helping us with that. So we're excited that that's kind of up and running a little more. And then, again, the behavioral and medical interventions in the community, that was something that's been in the report in the past as well. But we tweaked that a little bit to try to make sure that the information we were giving was information that was relevant. And really what we tried to do is use questions that we've received or feedback we've received to try to make the report be a little more relevant. So I'll stop there, and I'm happy to take any questions. I know this is kind of a revamp, so there may be more questions. Thank you for letting me take a little extra time to go through that.
Thank you, Ms. Hagan. See Dr. Phil Wilson's hand. You recognize about it.
Thank you, Rashad. Thank you for that report too, Julie. I just question I have has to do with, so we're requesting approval for the support waiver, which includes apparently DAHAB and pre-vocational. And then you allude further down to the settings rule and how that still is out there. So if we get approval to do DAHAB, for example, or pre-vocational training, which would not meet the intent of the setting rule when it was initially, put out there by CMS, what's going to happen there? Is that going to get rolled back, or are we going to have like a whole process of undoing what the setting rule was supposed to undo?
Sure. So we've worked closely with CMS, and the settings rule didn't necessarily say that you could not ever have pre-vocational or you could not ever have day habilitation. It said that if you have those services available, that you have to have certain requirements regarding community engagement and interaction with people who do not have disabilities. So we have made changes in the supports waiver to some of our service definitions. We are also trying to do, we've done some, anything we can do that doesn't have a significant fiscal impact tied to it. One of the problems we had is that across our three waivers, the supports waiver, the residential options waiver, and the new opportunities waiver, so our 3 adult waivers, we had different services, different service definitions, and different rates tied to those services. So what we're hoping to do with the waiver amendments is the first step in at least aligning our services and our service definitions. In DAHAB, we now have opportunities for virtual day habilitation, which we didn't have before. We have opportunities for what we call small group activities that have to be based in the community. We have, in terms of pre-vocational, we're putting a time limit to the amount of time that a person is able to engage in pre-vocational, and we have to be able to show that it's progressing towards true employment. We do also now have, based on several federal regulations, and I don't know the date, I think it's March, I think it's coming up soon, a requirement that there's no longer the ability to pay a sub minimum wage, that you have to have minimum wage if you're working, be that group employment or whatever. So what we were really moving away from absolutely facility-based was that more sheltered workshop. That's, HCBS settings rule doesn't allow that. We are also looking, we know that some of our providers who've had the most difficulty coming into compliance with the settings rule are those that are in our smaller, more rural regions. If you're in New Orleans or Baton Rouge, a lot of times, even if it's transportation, you have more options there. If it's doing things in the community, you have more options. Some folks that are in our smaller areas, and did love that video, Phil. Jill's sharing her story. When people are trying to go out, and even if you're trying to find a mom and pop to get a job, if you're in a small rural area and there's not a lot of jobs there, sometimes that's even harder to do and harder to support people that might be trying to come into compliance. So we are looking at where we might need to use some incentives if we have the ability to get some additional funding to help those providers. And one of the target areas we're really kind of looking at are those rural areas. Those are our providers that seem to be having the most trouble coming into this compliance with the settings rule. So that was a very long answer to say that we are trying to set up the services and the definitions to align with things that will work with the settings rule so that we don't have to undo. We've been working a lot with the SELN, the state, I always say it the wrong, State Employment Learning Network, I think. And so a lot of this we're running through them because they have worked with a lot of states to make sure that we're in compliance with the settings rule. So we're working closely in any of the definitions we've come up with. Our next step is if we could get any funding to support it. We know that there needs to be some rate changes to incentivize, especially individualized employment over group employment. But because we have that fiscal note, we have to be able to get the funding to then better align the rates and make sure we're incentivizing the correct things. But that's on our radar to work on.
All right, thank you, Ms. Hagan. See several hands. Mr. Edens, you're recognized by the chair. You have the floor.
Thank you, Mr. Chair. Julie, just a quick question. Do all the local entities that are getting new referrals for DD services, are they using the same eligibility assessment or criteria or application for referrals? And if someone is deemed eligible for DD services or deemed ineligible for DD services, is the person that is applying for services given something, say in writing, a letter determining that they're eligible or ineligible? And if they're deemed ineligible for services, does it specifically say why? And I ask that because I've often referred people to DD services at my local entity, and then a few weeks later I hear back from that person and I'll say, well, how did your intake with DD services go? And they'll say something like, oh, they just told me I wasn't eligible. When based on my assessment of that person and based on my working with that person, my opinion would be, well, it seems to me you would certainly be eligible. And they just say, well, they just told me I wasn't eligible. So I guess if I were going to advocate for that person, if there was some sort of appeals process for that, if I were going to advocate for them, it would be helpful for me as the advocate if they had something in writing that says, yes, you're eligible or ineligible, and this is why.
Sure. So we established, there is a policy that's established through my Office for Citizens with Developmental Disabilities regarding eligibility. We utilize the federal definition for our definition, and it is in state law. And we have a process whereby all of the local governing entities are supposed to follow the same process in regard to intake and eligibility. There is absolutely a letter that they are supposed to receive in the mail that identifies if they have been deemed eligible for services or ineligible for services. That letter is also supposed to indicate that they have an appeals process if they are found ineligible, and the process which they would follow to be able to appeal the decision if found ineligible. So all of that should be happening. If it's not, then as an advocate, you can reach out to me, because they absolutely should be getting that in writing. And once they apply, then they should get a decision letter. I can tell you that through the DD Council, we had some concerns brought up, I think it was last year, about eligibility. And we've been doing a lot of internal work, looking at our policies, looking at where we might need to have training, looking at how we make sure that we make things as consistent as possible. And within the next 6 months, we do have some additional training planned for the local governing entities specifically, and some discussions with them so that we can kind of revisit some areas that might sometimes cause concern or confusion, so that we can make sure that we are all on the same page, that we are looking at, cases that may be a little more difficult all the same way. So we do have that. We have been looking at our policy. We are planning to make some policy changes, and we are planning to do training within the next 6 months on that.
Okay, thank you, ma'am.
All right. Next hand I see is Ms. Jill Hano. You're recognized by the chair. You have the floor.
I saw you have a list in this report, which is very nice. Now that I know what I'm looking for, I'm great. you have it broken down into the flexible or the extensions that will continue, and then the exceptions that will not. So is this like a different form of what you broke down in the handout we received during committee?
Yeah, it's the same information. It's just broken down a little bit differently in the report. I did a separate handout, but it's the same information. Mhm.
Okay, so I can cross-reference. Okay, thank you.
You're welcome.
Okay, next hand I see is Ms. Heimel. Ms. Heimel, you're recognized by the chair. You have the floor.
Yes, thank you. Now, for the waiver slots, does that also mean if you have like a disability to get it? Or does that mean, you know, is it for both ways? For the ones who are not, have no disability, or some who don't have a disability and some do have like a disability in that. So how does that really, how does that really work? If, you know, both ways or just one? But what I'm also reading too is with leadership, with the staff beginnings. So how does that really work as well?
I'm not sure that I totally understand the question. The information that I'm sharing, though, in order to receive a home and community-based waiver in one of our 4 OCDD home and community-based waivers, you first have to be deemed eligible for OCDD services. And what that means is that you go through an assessment process, and you have to be able to show that you have a qualifying diagnosis, and then that you have a need for support because you have what is known as functional limitations in certain life areas. So you have some limitations that mean that you need some help in different areas. And so the assessment looks at the medical reports people has, and then it also goes through a need. If you're found to be eligible for our OCDD services, then consideration can be given for whether or not you have needs that can be met through a home and community-based waiver. There are other home and community-based waivers, and there are other services for people who don't have developmental disabilities, but are Medicaid eligible or meet a different level of care. And earlier on, there was a question, I think you had, Rosalind, about group homes versus nursing facilities. So there's an intermediate care facility level of care, which means that you have a need, you go through an assessment with your doctor, and you meet the eligibility for our OCDD services, but you also have a need for those supports, that active treatment, they call it. So you have a need to have some assistance at helping be as independent as possible. When you go into a nursing home, there's a whole different eligibility that you meet, and it's a nursing home level of care. That means you have a nursing need or something along those lines. And I can't speak very eloquently to that, but there's a different level of care you need for an ICF, an intermediate care facility, or a group home than what you need for a nursing home. But there are services that are in Medicaid and in what we call state plan for people that are Medicaid eligible and may or may not have disabilities. So the services that are in my report and what I'm talking about now are those that are for people who've been determined eligible for services through the Office for Citizens with Developmental Disabilities. Does that answer your question?
Oh, okay. That's what I wanted to know. There's my answer right there.
Okay.
Thank you. I see Dr. McKee, your hand is up. You're recognized by the chair.
Thank you, Mr. Chair. Julie, I was wondering where we can find those 7 core white papers that were provided to the MCOs on the adaptations to mental health treatment approaches for individuals with IDD. Where can we locate that information? That's my first question. And the second question was, I know some time back the council had expressed some concerns about whether or not there is some interagency collaboration and discussion between OBH and OCDD to help assist those individuals who are falling through the cracks, because there's like a tossing of a, you don't qualify for me, but let me send you over to here. And, and I believe a parent wrote an extensive letter about that and people falling through the cracks. So I'm seeing in your report that there is some collaboration in education and training, but what does that entail and how do we reach those individuals to let them know about these services that you're talking about, the ones that like are falling through the cracks?
And so for the white paper, I will have to find out about that, that particular, where we can get access to that and let Brenton know that. I don't know that off the top of my head. In terms of those folks that are falling through the gap, there's not a, so a lot of times folks think that within OCDD that we have some forms of treatment for people with behavioral health, but we don't really, in our waivers, in one of our waivers, we do have a service for psychological services, but it's very limited. The majority, the services, the direct, if someone needs direct treatment or needs services for mental health or behavioral health issues, in Louisiana now, all of those go through managed care organizations. And so it's not necessarily a different service for people. What we have been doing is meeting. There's currently 5 managed care organizations here in Louisiana. Each of those have a behavioral health medical director. And OCDD and our Office of Behavioral Health have started having meetings every 2 to 3 months with those medical directors so that we can look at the gaps and start to identify what we may need to change in our system to be able to help meet the needs or the gaps there, because the services themselves are with the MCOs now. They're not necessarily services within our system. And sometimes people think of Pinecrest, which is our state operated intermediate care facility, more as a treatment center, and not that people can't get treatment there, but it really is just a residential placement. If someone needs behavioral health treatment, those treatment options are really through the managed care organizations. But a lot of providers tell us that if someone does have a cognitive or a developmental disability, they're not always clear on how to adjust regular treatment to make sure that they're meeting their needs. So what we're doing is collaborating with them on ways that they may be able to adjust their system. And we do that through our OCDD Resource Center, which we have psychologists, social workers, occupational, physical, and speech therapists, and dietitians that are available for technical assistance and consultation. And what we typically try to do is, if folks have a treating person in the community, we pair our resource center clinician with the treating person in the community, and we can then help to tweak whatever that traditional is. And there's not a conflict there because our clinicians don't do billing or anything like that. That's something that we offer through the state. I can send you guys the link if you don't have it to anyone can request services. Anyone with a OCDD statement of approval can request services through our resource center for that. And so I'll be happy to share that with you.
Thank you, Julie.
All right. Thank you, Ms. Hagan. Do we have any other comments? I don't see any hands raised. What about in the public chat? Do we have any comments or questions?
There are no comments in the chat.
All right, thank you, Mr. Andrews. Since we have no other comments or questions, this report requires no action to be placed on file. So the next item of business is the report of the Office of Public Health, and the chair recognizes Ms. Baravecchio for the report.
Thank you. Good afternoon. I'm Patty Baravecchio with the Bureau of Family Health, and I'm here to share some highlights from our report. It's a rather lengthy report, so if you have any questions about something I don't particularly call out, feel free to ask me. We are the Title V administrator for the state of Louisiana, and we administer the Children and Youth with Special Healthcare Need program. And through this program, we provide direct services in some areas of the state where specialists provide to improve specialist provider access. These services are limited to individuals that meet financial and medical criteria. But they are available if anybody has a need of that. When Phil was talking, I had put in several links thinking that I was going to be ready to go, and they entered before I was ready, but I'm happy to share any of those links for more information on those specialty service programs provided by the Bureau of Family Health in the public health units. The Family Resource Center is also an initiative of the Bureau of Family Health. Previously, this was on the campus of Children's Hospital. With the onset of COVID, we determined to expand this service as a statewide virtual resource center. And over the past year and a half, we have been working to improve the center's access to anyone in the state. So I have put in the chat the email address for the BFH Family Resource Center. Families, providers, community partners can request services such as resource and referral assistance through this resource center Monday through Friday, 8 to 4 p.m. You will be answered by a live staff person, and they will absolutely help you to link to any resource needed. These are also related to social related health needs, not just health resources. And so right now we are working to expand this and like I said, improve our services. We have just implemented a new data system for the Family Resource Center to support our statewide efforts, and then a new phone bank. So if you do try to call them by phone and receive any, aren't able to contact, please email them and let them know, because we have a newly implemented system. So the Bureau of Family Health also has a project and collaboration with the Families Helping Families. This is a statewide initiative. We work very closely with Families Helping Families on initiatives to support children and youth with special health care needs and their families and the providers who serve them across the state. Upcoming in the spring, you'll see provider education workshops that each of the Families Helping Families will be sponsoring. And most of the topics that I've seen so far will focus on supporting families during that early childhood development period. One thing of note that we do have a Children's Special Health Services Transportation Assistance Program. It is set up to support families when Medicaid transportation is not efficacious for their need. So they have to go through Medicaid first. And if Medicaid cannot serve them, or for whatever reason, because of family health needs or just any barrier to using that service, they can utilize this transportation assistance program. Oftentimes it's a stipend and an allowance for possible gas and travel expenditures. So I encourage, if you know anyone that is experiencing a transportation need, please reach out to the Family Resource Center or to a Families Helping Families, and they can give them more information on the transportation assistance program. We do administer the Louisiana Birth Defects Monitoring Network. The biggest update on that is the Family Resource Center is collaborating with them to do outreach to families who have been identified through surveillance to ensure that they are linked with the resources and supports for to meet their child's needs. So this is a pilot. You'll hear more about it next quarter. We're launching it at the end of this month, and we've been preparing for it for about 6 months. So we're really excited about that. The Louisiana Commission for the Deaf is also under the OPH Title V program. And they are doing a lot of great work in the state. They're working to enhance and establish interpreting standards across the state. They have several legislative initiatives ongoing right now, and those will be reflected in the report as well. You'll see there's information in our report about, we also administer the maternal, infant, early childhood home visiting program. We have the genetics program, lead prevention. If you know a family that has a child with an elevated blood lead level, they can access resources and care coordination support through the lead program. And we also do school-based health programs, as well as the Developmental Screening Initiative. So there's a lot of things under the umbrella of the Bureau of Family Health. You can find more information at partnersforfamilyhealth.org or on the LDH website, Bureau of Family Health information pages. And if there's any questions for me, I'll be happy to try to field them.
Thank you, Ms. Barravecchio. Do we have any questions from any council members on the report? Okay, Ms. Haynes, I see your hand. You're recognized by the chair. You have the floor.
Joe, you might need to unmute.
My text message came back to me, but you were briefly answered, and I can't listen to, I can't listen to Patty. I'm gonna call you and we'll talk about this later.
Okay.
All right.
All right. Do we have any other comments?
I got it. I'll be brief, Miss Payee. So are y'all's initiatives gonna affect it found in the Louisiana Ldh Business Plan?
Yes. Oh, well, thank you for bringing that up. So for those of you who are familiar, the Louisiana Department of Health released a business plan this year, and there are several of our initiatives that are mentioned there. We'll be launching some collaborative initiatives around the state to improve developmental screening, and you can see a little bit about that work in the report. Included in that, we will be working with our key stakeholders to improve also perinatal depression screening in pediatric practices. So we will have more to report on that, but yes, we will. We are in several places in the the Ldh and the Louisiana Department of Health is the acronym, sorry, for the alphabet soup. But yes, the Bureau of Family Health has several initiatives that will be tracked by the state on different initiatives. The ones that touch us the closest are the ones on developmental screening. And we especially work around that 0 to 3 population so that we can, the idea behind it and the evidence behind it is that the earlier we identify children at risk for developmental delay, that we can provide access to early interventional therapies and remediate or remediate that delay. Thank you, Jill, for that question.
All right.
Right. Thank you.
Do we have any?
Any?
All right. Do we have any other questions from the council?
Question. Oh, sorry, from the public. No council members have their hands raised, but Charlie Michel in public has his hand raised.
All right, Ms. Michelle, you're recognized by the chair. You have the floor.
Thank you. And I wanted to just piggyback on what Patty had said, because their work with early intervention has profound ripple effects for those children, because there is so much research that supports that early intervention will not only help their immediate medical needs, but it assists them in the educational development all along the way. In many times, it will prevent the need for special education intervention services, but in other cases, it helps to level the playing field because their needs have been identified much earlier. And the disadvantages they have, especially if they're children of poverty, will be far outweighed. The disability will be mitigated much further because of the early intervention on the part of Patty's organization. And I just wanted to say that it is not, we're not operating in a silo, we're all partners.
All right.
Thank you, Charlie.
Do we have any other comments from the public or council members in regards to Ms. Beravecchio's report?
It does not appear so.
All right, well, thank you very much. This report requires no action. We place on file. So now, next item up for business is report from the Governor's Office of Disability Affairs. Ms. Polar.
Hi, everyone. How are you? Are y'all gonna be able to pull up my report? Everyone to see. Thank you. And Brenton, can you move my people over? I appreciate that. First off, just want to let you guys know, as most of you are aware, we have our annual Gold Awards, which didn't happen in 2020 because of COVID, but we did have it in December. We had a limited in-person capacity, but nonetheless, the Gold Awards took place, and we have the list of people on the screen who were the recipients of the awards. We also have a link to the recording of the Gold Awards, which will be included in our upcoming newsletter. So if you're interested in that, you have that, and just wanted to congratulate all of our winners of those awards. Also, just wanted to share with you a little bit about our and our inclusive art contest as well. I apologize. We have our winners listed here for our inclusive art contest. Actually, I see here the link is already in the report, so I didn't think we had that, but the link is in our report. Also, just wanted to give you guys an update on our councils. So as some of you may be aware, effective January 1st, the statewide Independent Living Council is no longer in the Governor's Office of Disability Affairs. And that is a big success for our office. They have transitioned out, and that was been a goal for several years. And Jamar Ennis is now the executive director of the Silk in its capacity now. The Governor's Advisory Council on Disability Affairs continues to meet quarterly. Our next meeting will be on April 16th, which will be on a Wednesday, 1 o'clock. It will be 2 days into our regular session. We are hoping if the COVID numbers go down, that we will have an in-person option like we had for our December meeting, and also a virtual option so people can participate. The week prior to that, which is the week of March 7th through the 10th, we'll have our committee meetings at 3 o'clock in the 3 o'clock in the afternoon on those days. And we'll have that information in our newsletter. I hope you all are receiving our newsletter. You all know Lillian Dejean, who is our senior coordinator in GOTA. She is serving on the Voting Systems Commission. She actually attended a meeting yesterday and is doing really good work in advocating for accessibility in voting, and has also met with the Secretary of State and getting some good responses in looking at some features that will make remote ballot return accessible remote ballot return for people with disabilities, something that is an option in our state. So really hoping that that will come to fruition. Also just wanted to share that I was appointed to the Community Responder Task Force. It's not in the report, but it's a task force that was put in place by Senator Katrina Jackson, and it the focus of that task force is to look at all of our responders whenever we're interacting with the public, and should that all be basically, should we call police for everything, or how can we engage behavioral health in the process and being able to triage situations and respond more appropriately and identify when it's really a public threat, or whenever we have a medical or behavioral health issue, and respond more appropriately. So I think based on our discussions, as council has discussed many times about the importance of that. And so hopefully we can get some good work and recommendations from that commission. Also, as I said, Jamor Ennis has transitioned out, and just have a little bit of update about Jamor. Also, just scroll up, Melanie Washington, who was our former executive director. She's still in the governor's office, but she's now the director for the Children's Cabinet. So it's great to have those two individuals still working on really important community-based initiatives, and so still partnering with them in a lot of ways. And right now I asked for Brenton to allow Alicia Vaillant and Jordan Briscoe for their video to be shown. I don't know if maybe you need to not share the document anymore so we can see them. Are they on the screen? I don't see them.
I'm here, Bambi.
Okay, there's Jordan.
Good afternoon. I'm here, Bambi.
So
everyone.
Alicia Vaillant is our new director for the SICC, the State Interagency Coordinating Council for Early Steps. Alicia has almost, I think, a quarter of a century experience in education, and a lot of personal experience around disabilities. So she's hit the ground running. And then Jordan Briscoe is our new assistant director for the Governor's Office of Disability Affairs. And Jordan has a background in healthcare. And so we think she'll bring a lot of experience in that area and understanding system, and hopefully helping us to, if you ought to see their faces if you see them around. I'm going to say my internet is unstable, but can you still hear me?
Yes.
Can you guys hear me? Okay.
Yes.
Yes.
So that's it. If you have a question.
Okay. Thank you for that report. Ms. Palazola, and congratulations and welcome. Ms. Briscoe, Ms. Valiant, I hope I pronounced your last name right.
Thank you.
Do we have any comments from the council members?
I do not see any hands raised or any comments in the chat.
Okay. Thank you, Mr. Andrews. So we will accept the report from the Governor's Office on Disability Affairs. Requires no action, so to be placed on file. So the next item up for business is a report from the Department of Education. We yield the floor to Ms. Meredith Jordan. Ms. Jordan, you have the floor.
Thank you, Chairman, and good afternoon. It's a pleasure to be here and to have been here today. Listening, getting feedback, and kind of getting updates from valuable members across our community. So I will start. I know at our last meeting, we had some discussion around teacher shortages that are plaguing our nation. And of course, we're experiencing those in our state. And so I wanted to bring an update on our educator recruitment and retention recovery work that's being led by both the Board of Regents and our educator development team at the Department of Education. So during last legislative session, the Recruitment, Recovery, and Retention Task Force was created, and they have released in a preliminary report some of their recommendations, both for our educator preparation providers in our universities and community colleges across our state, as well as recommendations for educator development and support at the department. And so you will see some of these here. Creating a campaign elevating the teaching profession, planning for incentive-based compensation, developing support for aspiring and current principals, which that work has started at the department, studying the impact of Praxis Exams on educator preparation program enrollment. And so the Praxis exam is that certification exam that educators take in order to receive their teaching certification. And then providing research and guidance for teacher well-being and supporting their social, emotional needs as well, especially with the pandemic, hurricane impacts across our state. We need to take care of our educators and support them as well. To help retain them in the profession. And so we did in our committee meeting talk about this, and they requested, several folks requested if there was a report posted. I didn't find one posted, but I did send Chairman and Executive Director DeVille a copy of that report that I received from our so that they can email that. Feel free to email that out to this council. So it's not posted anywhere, but happy to share that report once I figured out that it did exist and obtained a copy of it. So you'll see that it says in there that it was a preliminary report. It's also going to the legislature this month. And the next steps for this task force, they will continue to meet bi-monthly, doing research, answering questions, providing additional recommendations, and I believe they will submit another report in December of 2020. And so I also wanted to just talk with you all about some of the current opportunities for school systems that we have started this year in response to this. But of course, y'all know I'm always looking for feedback, ideas, input. So we did launch a Para-Educator to Teacher opportunity this year at no cost to our school systems for para-educators to receive a bachelor's degree and hopefully grow them, train them, support them, and grow our own educators, because we do know that we have some wonderful paraprofessionals in our school system who may be interested in becoming certified educators. We also have given our school systems the opportunity to apply for optional funding for some add-on certifications. So just to provide further training for teachers. And so a couple of those would be to get their mild moderate add-on certification. They have the opportunity to request funding for teachers who are teaching our English language learners to add on their English language certification. And so school systems can request up to $4,000 to add on that mild moderate certification, and they can request up to $2,000 to add on an English learner certification. So those are a couple of opportunities that we do have in place for our school systems this year and that they're beginning to take advantage of. And we'll do another cohort of the Parrot Educator to teachers for the fall of 2022 session as well. So we'll continue that that opportunity. And so I'll move to the next piece within my report, which is on our state performance plan, which I am seeking your input on here today. So I'll talk to you a little bit about the survey links there. But IDEA requires that each state have in place a state performance plan. And that plan describes and evaluates our efforts to implement the requirements of IDEA. And so it includes targets for 17 indicators to have linked here so you can take a look at all of those indicators. But some of them are compliance indicators. For example, getting evaluations done on time. Some are performance indicators, which are around our students with disabilities performance on assessments, our graduation rate for students with disabilities. So some of those more measurable outcomes for students with disabilities. So it includes both compliance and performance rate related indicators. And so we are given a rating annually around, and that's called an annual performance review from OSEP, and it is geared towards, and that data and that that performance is rated based on this state performance plan and these indicators that we have linked here. And so we are now in a target setting process. So every 6 years, we submit a state performance plan that includes targets around those 17 indicators. So we're working internally at the department, engaging really so that my colleagues at the department have a department-wide ownership of the performance of our students with disabilities. And as well, we want to get stakeholder input around these targets. So we ask that, that you visit our landing page. When you click on that landing page link, it gives you kind of an overview of what this process is. And then you'll see on the right-hand side, there's a link to an overview, which tells you our performance right now towards those 17 indicators, as well as you'll see a link to a survey, which is where you can go on and submit via this fillable PDF survey. And you can give input and tell us what you think those targets should look like. How can we make them rigorous yet meaningful? And so this is really important for me. I value this group, this council, and our community members' input here. So we're definitely looking forward to hearing input on those targets and on that data. So I'll skip down to the next piece on our report. I definitely wanted to mention our upcoming Jumpstart Convention next week, which is currently sold out, but it will provide school systems with important information related to career and technical education, graduation pathways, successful transition after high school. And I will be leading and put together a panel that includes several folks here today. I know Melissa mentioned it earlier as well with LRS. And so we'll have various panelists there. And that session, our session will really be geared towards helping school systems and educators to create inclusive career and technical education programs that include all of our students, especially, y'all know our focus is around students with disabilities. And so I'm very excited about that panel. We did have some questions during committee if any of the Jumpstart sessions will be virtual. I did ask, and there will be a set of sessions that will be accessible virtual. And I do believe we're repeating our session twice. So we're doing a morning and we're doing an afternoon to try to get as many participants there to come in and hear what we have to say and see some model school systems that are doing this. And I did hear that one of ours will be accessible virtual. So Chairman, I can send that information to you as soon as I receive how that will be accessed. And I can send that to you so that you can share that with whomever may be interested in that. And then last, I wanted to touch on, again, another huge annual event for educators across our state, which is our Teacher Leader Summit, which will happen in May. It is planned to be in person, but if any governor's orders change, we would switch to virtual as well. But it is an annual professional development conference that brings together all of our Louisiana educators, administrators, superintendents from birth to grade 12, content experts. We are accepting right now presenter applications until February the 4th. And we're excited about our Students with Disabilities track and sessions that will be available for educators who are impacting our students with disabilities. And again, that's going to take place the week of May 31st in New Orleans. And so that concludes my report, Chairman. I'll be happy to field any questions or receive any input and feedback as always.
All right, thank you, Ms. Jordan. I see we have one hand raised, Council Member Logan Davis. You're recognized by the chair. You have the floor.
Oh, I forgot. I have my hand up for a while. My bad.
Not a problem. Do we have any other comments or questions about the report that was presented?
There's one question in the chat from Charlie Michel says, will the Parrot to Teacher initiative include the earning of a college degree, LEA training, or both?
Yeah, so they will actually earn, we partnered with Reach University and they will actually earn a bachelor's degree.
It's good to know. Ms. Andrews, do we have any other comments or questions in the chat?
Looks like Mr. Davis's hand was raised, and you also have Ms. Karonda Corley's hand raised.
Okay. Mr. Davis?
Okay, I remembered it. Can you touch on the Praxis exams? Because there are like multiple exams to that, correct? And you have to do certain amount of prerequisites, and then after, so are y'all like streamlining it? Can you touch base on that one?
Yeah, absolutely. So our certification department takes lead on teacher certification applications. We have a lot of guidance on our website around what coursework is needed, whether you're looking to become a high school mild moderate teacher, a middle school mild moderate, or severe profound add-on. And so there are lots of options there, and it kind of explains to you which courses that you need to take, as well as which Praxis exams that you need to address in order to receive and have a successful application to add on that certification, whether it's a mild moderate. For our English learner add-on, there's specific course requirements that you must have, as well as a set of exams. Very good question, and hard, long answer, but it kind of depends. It depends on which add-on that you're looking at in terms of what those requirements look like.
Okay, so when you're saying mild to moderate, moderate to mild, or moderate to severe or severe, that's about the individual's disability, correct?
Correct. So there would be specific course requirements around specific courses on students with disabilities to be able to, in fact, receive that certification. There are specific courses that would need to be taken, introduction to IEPs or serving students with disabilities, evaluating and assessing. So there are several different topics and courses that have to be covered in order to receive that add-on. Absolutely.
Thank you so much.
Ms. Coley, you're recognized by the chair. You have the floor.
Thank you so much, Mr. Chairman. How you doing today, Ms. Jordan?
I'm good. How are you?
I'm wonderful, and I have several questions.
Absolutely.
The first question is, what are we going to do to ensure that the staff is actually equipped to work with our children with disabilities? As we are aware, having a BS is not enough. I have a lot of children that are being arrested and read their rights as young as 10 years old. I have a case, as you was aware of, during the Bessie Board meeting that I was contacted about. That is now my case that I'm working personally, that the child was read his rights and arrested, all due to staff not knowing how to work with our children with disabilities and not being educated and informed about different disabilities, particularly if the child have any type of neurological impairments that affects their ability to speak. So what are we putting in place as the State Department of Education to ensure that the staff actually know how to work with our children? That's the first part. That's the first question.
Yeah, I agree with you. We know that we have work to do around educator development, professional development, specifically around IDEA policy, practices, procedures, discipline. So, there has to be very specific professional development there. One of my goals too is to begin and start back we used to host special education regional director meetings, where I think it would be great to include some of those topics, have those educator sessions and those support sessions with them, where we can bring to them those specific policies, talking about the law, what they should and should not be doing. We also have, Ms. Corley, and I can work with you specifically on this too, but we do have processes in place where we can go in and help school systems through IEP facilitation, mediation, dispute resolution, if needed, to help address some of these very specific complaints and issues. Because I think you're absolutely hitting the nail on the head, that we have to better support our school systems with implementing these policies, making sure that they understand them, because we do know we have a lot of new special ed directors as well. We did see a turnover in special education directors and supervisors. So we do have some new ones, and we're working with some of them in our SPED Fellows Academy, and we have a topic around law and policy. And actually, we're going to put out next month, We are creating a guidance document specifically to address creating compliant and inclusive special education programs. So that will help. And our intent was to do exactly what you're talking about, Ms. Corley, like just a refresher on IDA law, ESSA law. What are the things that school systems need to do to be compliant? Looking at their discipline data, I think those things will help, Ms. Corley, but certainly, that educator support is going to be critical in helping to meet the needs that you're speaking of.
Okay, the second question that I have is in regards to the evaluations. Just as you stated, a lot of the superintendents and special education directors are new. So they're not equipped with the knowledge to actually do real true evaluations for our children with disabilities, which are actually having them have the incorrect exceptionality, or if they're given the correct exceptionality, they're not given the proper assessments and the proper tools in place, such as emotional disturbance, no behavior intervention plan, autism, no behavior intervention plan, other health impairments. Some of them are not having functional behavior assessments, no behavior intervention plans, no health plans. What are we putting in place to make sure in the State Department of Education that this is actually going to take place? In addition to that, what are we putting in place to prevent the retaliation? Because we are having parents retaliated on left and right for filing cases or filing state complaints against that actual school system. What are we putting in place to prevent the retaliation? And last but definitely not least, what are we putting in place to ensure that when a family asks for a camera in the classroom, that they actually can get that camera in the classroom?
Yeah, both really good topics. So let's talk about the evaluations. You mentioned superintendents are new. We have special ed directors who are new. How do we ensure students are receiving a comprehensive evaluation and assessment so that we understand their present levels of performance and we understand what supports, and we can develop an appropriate IEP that's going to help them be successful. One of the things that I'm working on, because I saw a need as well for our pupil appraisal staff. So anyone who would be involved in that evaluative team, we haven't provided much support that I can tell over the past few years. So I am working with a partnership and I'm hoping to launch a summit or a convening this summer for pupil appraisal and those evaluative staff. Again, to develop that knowledge and to share best practice, to talk through their struggles, make sure they understand what a compliant evaluation looks like. How do I ensure I'm giving a comprehensive evaluation and touching all of those pieces and all of the needs for students? So I think that's a start, but I definitely agree with you that our pupil appraisal staff certainly need additional support from the department, and it's certainly a goal of mine. I completely agree with you. With regards to the cameras in SPED classrooms, we talked a little bit about this in our committee. The way that the law is currently written, the department doesn't have any oversight or accountability or authority. And so what I talked with our SPED directors about at the beginning of this school year, because really the initial step in implementing that legislation, and you know, school systems typically have approximately a year to implement new legislation. But the initial step is to write policy in alignment to that law. So that was my recommendation, and really the only recommendation or input or support I could give them But they did have questions that I wanted to answer them. I wanted to give them some support. At the beginning of the school year was to begin writing your policies. Look, work with your local council and begin to draft policy in alignment with the law. And so many of our school systems are in that process and they're doing that. And I also urge them to work with each other, connect with your neighboring school system to see what have they thought through, what issues are they thinking that they're going to need to address in their policy, what does that look like? Because really, as the law is written, the department couldn't provide any guidance. We couldn't provide any templates for them to use for that policy. So I am closely watching this for legislative session. I know we are at the department to see, will there be any updates? Will there be any changes? I know most school systems, the issue is funding and how to fund those surveillance systems in classroom and have the software to protect student privacy, the monitoring and the storing. So I certainly appreciate the discussion and input around that legislation for sure.
Okay, and this is my last question, Mr. Chairman, if you don't mind, because I want to ask this one last question.
I permit have several other hands, so go ahead, Ms. Corley.
Okay, my very last question is, we've had a lot of children with disabilities that have been abused in the school system. And the school, as it's written right now, a school system can actually contact DCFS on a parent, but a parent cannot contact DCFS and the police department on the school system because the school systems actually contract with the local police as SROs. So I am asking, as the State Department of Education, will you be creating a database for on the staff that have been charged with abusing or neglecting children with disabilities, so that it will prevent them from being hired from one parish school system to another? And are y'all considering any type of legislation to have DCFS or the police department to be able to investigate any of these claims by the parents when it is alleged against the school system, just equally like they do the parents? That was my last question, Mr. Chairman. Thank you.
Thank you. Ms. Jordan?
Yeah, this conversation is infuriating because that it shouldn't be happening. So school systems should have in place.
Excuse me for a second, Mr. Chairman. Can I please be excused? Can I please be excused? I should be back in
Yes, ma'am.
4 minutes.
Yes, ma'am. You can be excused. Please proceed, Ms. Jordan.
Yes. So school systems should have in place. I mean, all school systems are required to do a background check. So we know if it becomes a legal issue that these folks would be caught through background checks. But we also, when we do receive this information at the department or we receive complaints around this, we do follow up and we do address it. I'm not aware of any legislation, Ms. Corley, but I will bring this back to our team and take a look at this. In fact, this was also something that I wanted to, in prep for perhaps updates to the camera legislation, was to see what kind of data we have at the department on complaints for abuse of children, but unfortunately, a lot of that would go through DCFS, as you mentioned. But what complaints are we getting? Are we seeing any complaints? We currently, to my knowledge, we don't have a database where we're tracking individuals that we have received, that we know or have been convicted of abusing children or students with disabilities at all. And I don't think that would probably be something that would fall under the purview of the department, but I do want talk with this and follow up with this with our legal counsel as well. But I said it's infuriating. It's infuriating because the people that we trust most with all of our children and with our children with disabilities should not in any way be hurting them or harming them. So I certainly want to follow up with our legal counsel as well, as far as complaints that we've received or how we, what processes do we have in place. Thank you so much, Ms. Corley.
Thank you, Ms. Corley, and thank you, Ms. Jordan. Dr. McKee, I see your hand, you recognize, you have the floor.
Thank you, Mr. Chair. Thank you, Ms. Jordan. This is the very first time I've heard the word compliant come from the Louisiana Department of Education within the past maybe 16 years. Typically, we don't hear that type of wording as compliance. So I'm grateful that you did use the word compliant and compliance, because that is what we're working towards. I do see that there's a lot based on your report, a lot that's on the side of educating teachers and educating staff and, you know, on different things and what the responsibilities are. But I think the level of frustration from our advocates and parents is on the enforcement side. You know, we have a lot of guidelines. We have a lot of information with words on pages and different colorful PowerPoints, but we have no enforcement. And so it is not good. So the frustration that you're hearing is that what we need is more oversight. What we need is more enforcement. What we need is to make sure that when the guidelines are written, that the districts are actually implementing what's written. And if there's some type of consequence or whatever that happens, if they don't enforce, you know, if they don't adhere to the word compliance that we are, that we're talking about. So I think that's where we need the support. I mean, we don't need many guidelines. And I also want to say to the other council members, as it relates to the special education and cameras legislation, we need to strongly let our legislators know that we need language to be put into these laws and in acts that allow for this enforcement, because what's happening is it creates a loophole for the Department of Education to say that they cannot enforce. And I'm concerned about that. I've heard that over and over, what we can't do. Where we are now is to have wording where it's going to say, this has to happen to protect our children. And I mean, the advocates have fought so much for this special education. We're hearing now we don't have funding. Now we can't tell them this. Now we can't. So we need the wording. So I'm saying that to my advocates on the call. So let's fight to do that. I also wanted to speak to what Ms. Corley's comment was about the staff abusing students and not being able to report it to the to law enforcement. This is my first time honestly hearing that, because I know that if something is reported on campus to a mandated reporter or a mandated reporter, is supposed to report that. And if they don't, there's some consequences as well. So Ms. Corley, at some point, if you are willing to share that information so that we can provide support to look more into that, because that does not sound like it should be happening. We know it's not, shouldn't be happening. So please, whatever information you have on that, please forward to the council, or you can forward to the Education and Employment Committee Chair. Thank you.
Thank you, Dr. McKee. Do we have any other, I don't see any other hands raised for the council members. Do we have any public comment?
Yes, you have two hands raised, Ms. Alicia Valiant and Charles Michel.
You're recognized by the chair. You have the floor. Ms. Alicia Valiant, you're recognized by the chair. You have the floor.
Thank you, Mr. Chair. Ms. Jordan, in regards to para to teacher track, that's a regular, the para would receive a bachelor's degree, correct?
Correct.
And then they'd have to go on for certification, or is that some type of alt program?
Right. No, so they would receive their bachelor's in an education track, and they would come out a teacher.
So they would not have to take the Praxis?
Yes, I'm sorry. Yes, they would still have to. take the praxis just as you would if you were in a university or a community college. You get to the end of your education program, or you get to the end of your degree program, and you take your praxis and receive your certification. Yes, they would still have to go through the steps.
Will the state offer some sort of stipend to help them pay to be able to take that praxis?
As part of that $4,000, school systems may be also paying for the certificate, the actual like praxis and the application for certification, but they may be using the majority of that to pay for the coursework.
The course is right. So yeah, because that would be a
Right.
shame for them to work so hard and then not
Right.
have the money to pay for the praxis.
The
is what
certification.
I'm asking if we look at the whole picture. I think that's a great program, but I want to be sure we look at the whole picture because you do have to pay to take the praxis.
Yes, yes.
And Ms. Corley, I am fresh out of the trenches in education. And this is the first I've heard about someone not being able to, I'm going to use the word complain if they thought somebody was being abused. Because as a matter of fact, we've had a couple of parents use that as a revenge method. You know, when I would get a teacher, I was an administrator, when I would get a teacher to write a statement about something, or so as far as I'm aware, you'd follow the same process as if there was something that happened on the street. And you know, OPD, I'm from Opelousas, so Opelousas Police Department does the same type of investigating as if a teacher was just a regular person on the street. So I hate that that happened to someone, because the police department is usually very cooperative either way, you know, if it's a teacher against a parent or parent against a teacher. And thanks for clarity on the parent to teacher track, Ms. Jordan.
Okay,
That's all I have,
Uh,
Mr. Chair. Thank you.
you're welcome. Mr. Charles Michelle, was he the next one with his hand raised?
Yes.
Okay, you recognize, you have the floor.
Thank you so much. Just a couple of little points on what's been talked about in the last few minutes. First off, the idea that parents can't complain or call DCFS on school systems is erroneous. And if that is happening, then I believe that whoever it's happening to should seek legal assistance, because in my 34 years in education, there were many parents over that period. And when I say many, I don't mean hundreds, because it doesn't happen that frequently. But there were many parents who did call the schools, call the authorities on the school system, and an investigation was conducted. At the end of the investigation would be either it was found that the school did in fact do what they said, and then legal action would be taken against that employee, or the school didn't. It's just like any other investigation. Whatever the truth is, it is what it is. So that is possible. And again, if it's not happening with someone that you know, please advise them to get some legal assistance. The other thing is school district employees are mandated reporters. So when it said that school systems can call DCFS, it's a mandate. They must call DCFS if they suspect any kind of abuse. And it may not be that it's abuse. It could be something very simple, but that's the purpose of the investigation, to ensure that the interests of the child are being taken care of. So that way, maybe why it seems a little lopsided. I also want to remind everyone that when anyone calls DCFS about suspected abuse, it is supposed to be anonymous. Many school districts have procedures and policies in place that say that the reporter has to notify the principal. That is illegal, but many districts do it. So just know that you really don't have a right to know who's making the complaint. And that's for the protection of all involved. Now, the other thing is when we're talking about campus police and the way that they're used, we know that this is a huge problem because training is limited on all sides, the police department, the school system. But as we're looking at this, Meredith, I hope that y'all will look at a broader picture. Because when a teacher does something like that, which is so wrong on so many levels, the truth is, I think that is more an issue of leadership than that teacher. Because if that teacher is ignorant of the law and the rules, it's because her principal didn't talk to her or him. If the principal doesn't know, it's because the special ed director didn't get with them. If the special ed director doesn't know it, it's because the superintendent didn't let them know, or the State Department of Education didn't know. So the training should not be focused just on the teacher, because if you hit it with one layer, it doesn't change the culture of the organization. So that's what I'm going to say. And there are ramifications that many superintendents, because they're new, just like the special ed directors, they don't understand the ramifications of using an SRO or school resource officer as an administrator. The fact is, when they use a police officer as an administrator, it ups the requirements of the administration of the school to do any kinds of investigations. So they need to be informed of what the ramifications are of that. So those are the two things that I want. Hit it with a broad brush, because that's the benefit of everybody involved: schools, parents, children, everybody. All right. Thank you all so much for your time. I appreciate it.
Thank you.
Thank you, Ms. Michelle, for that insight. Ms. Haynes, I see your hand raised. You're recognized by the chair. You have the floor. Excuse me, Ms. Eagley. Ms. Eagley. Ms. Eagley.
Okay, so I'm confused. The Louisiana Department of Education, I've been hearing this, and can somebody on the DD Council, members or panelists or staff, tell me what this is all about? Is it like people investigating for people with special needs, hurting them physically, like punching on them, getting the cops involved? I'm very confused, and I'm an advocate for all, so I want to take a stand, but I'm a little confused. And why would they want to hurt somebody that's different?
Ms. Jordan, I yield the floor for you to bring clarification from Ms. Eagley.
Sure. And Ms. Eagley, that's my, my sentiment as well as Mr. Michelle. Like I haven't heard of, I haven't gotten any complaints, and I don't think anyone at the department, but for sure, like everyone has mentioned here, this is a law enforcement issue, right?
Wow.
And a mandatory reporting. I'm glad y'all mentioned that. Absolutely. But definitely law enforcement should be involved. The department isn't the that could bring justice to that. I agree with exactly what Mr. Michel said. That's a law enforcement. Call the police, get those people involved, because I know if we did get that, that's exactly what we would have to do.
Yeah, I totally understand, because people that are different, if somebody's hurting somebody or assaulting them in the schools, and they need to get the cop involved, because nobody, a parent who has a son with the IDD doesn't want to come home and see all these marks all along them. And it's like, who is trained properly? I mean, or sorry to bring this up, we wouldn't want those little ones to get assaulted and maybe sexually assaulted. I'm an advocate for all, and I hope to be on the DD Council in the near future, but this is not acceptable when people that are different, because then these parents are worried. I want my child to come home safe, and I don't want them to go missing.
Exactly.
All right, thank you for that. Do we have any other comments in regards to the report that was presented by the Department of Education?
You do have another hand raised from Ms. Kathleen Canino. There are also some comments in the chat. And some of those comments are actually from Ms. Canino. So if she wants to address them when she has the floor, that would be great.
Okay, Ms. Canino, you're recognized by the chair. You have the floor.
Thank you. So I had a question. Can the Louisiana Department of Education enforce and provide oversight and monitoring? Because it depends on who you ask, but you get mixed response to that. And then also, if you do have a child that is abused in a school setting, it is required to be reported to law enforcement and DCFS, and the law enforcement is who would investigate it. And the problem comes in where the schools are all contracted with the SRO for SROs, but those are the normal police and those are the sheriff's office. And so they have contracts with all of them. So you have that bias for the parent or for the child when you hope to get things investigated. I know of 2 cases in the past few months in Lafayette where the child with special needs was assaulted by an employee and made the paper. And I guess I'm asking, is there something that Louisiana Department of Education could create, maybe a form that's easy to fill out for parents and submit, because I know when that happened to my son, I had zero idea of how to go about reporting it. And it would just, I think it would be helpful to have that form and to have an email where you're supposed to send it, because I did try to do that. And then I got an email back from LDOE saying that I had sent it to the wrong place. And I asked a question where I should send it to and never got a response. So those would be some of my concerns. And then also, law enforcement seems to not be aware of laws that protect all people with disabilities. They don't know about restraint and seclusion laws, or the time frame in which it's supposed to be, the parents are supposed to be notified. The schools seem to, superintendents and SPED directors, I believe, need to be made aware of that as well, because kids are being restrained improperly, and then corporal punishment is not legal to do on children with disabilities in Louisiana. And so if they are restrained improperly and it leads to injury, that can be considered corporal punishment, but yet nothing's happening. It's just like, oops, they didn't have intent, bad intent, so nothing happens, except for that child is injured and that child is scared and has everything to deal with, but there's no repercussion and training's not being done. And anyway, I'll get off my soapbox, but thank you.
Yeah, I appreciate that, Ms. Canino. And we do collect data on restraint and seclusion incidences. And we also collect, so school systems are required to send us their policy on restraint and seclusion. And that is a part of some of our monitoring. I know that you asked sort of that general beginning question, like, does the department have any oversight in monitoring? We do provide statewide monitoring. Now with COVID, some of the on-site monitorings, those have not been, so a lot of that was desk monitoring. But our statewide monitoring team this year should be, pandemic permitting, going back to some on-site monitorings for folks who fall in, or for school systems that fall in certain risk levels. So we do have and should have oversight with monitoring implementation of IDA. And we can place school systems in corrective action for certain things. And that does happen. And then we provide that oversight and we help them correct policy, procedure, practice to get out of that corrective action. So we do have that ability.
Well, can I just say one thing? With the restraint and seclusion, the problem is they are unaware or seem to not know that they're supposed to report it to the parents within 24 hours. That's not being done. And then the other part is
in law.
Yeah. And they're saying that this one incident, they said, they only reported to the state if the child is injured while they are performing the restraint and seclusion.
Yeah, that's something that we can communicate. We could do, we can do some training on just kind of a refresher of restraint and seclusion law. What are the do's and the don'ts? Because
please,
we are based on the law. Absolutely, absolutely. And the best email, Ms. Canino, to ask a question, even for parents to request state assistance and resources, is special education at LA.gov. That is our inbox where we take those requests from parents as well, and try to help provide some supports. And I appreciate you, as always.
Okay. I see several hands hands. I'm gonna recognize Vice Chair Banks. You have the floor.
Thanks, Chair, for recognizing me. First and foremost, I just want to commend all of the people that have gotten up here and have spoken about this issue, because I wasn't even aware about any of this stuff. And that is so awesome that you guys are using your voice to speak up to us, because we're not in there every day. You guys are in there every day and you're seeing it. So, you know, I commend you guys. Keep on speaking up. You know, don't ever lose your voice in thinking that, you know, oh, you're scared to say it. So just, you know, I commend you guys that have spoken up. All of you guys, Miss Coralie, you know, trying to get all y'all comments, but Miss Katie, all of you guys, Miss Kathy, all of you guys have done such an awesome job with putting this information in the forefront. But my question is, or maybe my suggestion, moving forward, is to have a comprehensive, detailed training on how to handle situations like this, or how to handle, you know, people with intellectual and developmental disabilities that have those kind of outbursts. You know, I dealt with that in high school. It was like a little intern thing that my high school had. So, you know, I think it is very imperative that they come up with some comprehensive training that everyone has to go through, because every teacher ends up having to deal with it anyway the cut goes, whether they're in special ed or not, and have this done quarterly, and have where a training has to be done and it is mandatory, and where we put it in place, because this is, I'm very upset that something like this is going on in our states and stuff can't be done and people can't speak up and this can't happen. And okay, moving forward, what needs to happen, we need to have this quarterly. So at these meetings, we can see like, okay, this parish, all their teachers went through the training. Let's see the report. Okay, the other ones, okay, this parish, you know, and that's how we try to hold some kind of accountability going on here. Because if nothing is, you know, you can report it and then no investigation happens and then it just gets pushed under the rug. And then here you're another person that had the same thing happen to them. So it's like, you know, at some point we have to stop and reevaluate things and be like, okay, this is not the way that we have to continue to keep doing this. We have to change things, because now people are getting hurt, you know? So we have to bring that into it. And I love what Dr. McKee said about bringing it to the education and inclusion, so that we can further discuss this and see how we can move further as a council to help with this process, to hold some more accountability with this with these situations, because it's happening in obviously a lot of areas. Lafayette, Livingston, St. Tammany, Ascension, East Baton Rouge. That's too many parishes. And East Baton Rouge is our capital. Come on, Louisiana. We got to do better. We have to. And I know that we can, with these group of people that's coming out here voicing their concerns, and, you know, with everybody that's here collectively, I feel like we can make that change. We know about it now. It's time to do something about it now. That's all I had to say. I yield the floor.
Okay.
I appreciate that, Ms. Banks. And all educators are, I do know there is legislation that requires them to go through annually mandatory reporter training, because we had to, you know, what steps should you take? But I'll find out if we collect that data at the department. And if so, that's something that I could bring and start that discussion point too.
I'm getting ready to take this conversation offline, because we have a couple contactors saying they're gonna have to log off at 3:30 hour. Ms. Hogan, you're recognized by the chair. You have.
Thank you, and I'll be brief. I just wanted to state that a lot of the parents that I work with to experience kind of what has already been explained. When parents begin advocating for their children, sometimes the SROs are being used as a form of retaliation. I personally have had that happen to me, where I was doing the advocacy for a client and my child was arrested for something that was related to his disability. My question is for Ms. Jordan. You said that you do monitoring and you're collecting data. What is kind of the criteria for the Department of Education to do these enforcement activities? What has to happen for you guys to kind of go into a school system and do some corrective actions?
Absolutely. And that's a tiered system that I can also bring back. I'm putting that on my piece for our next committee meeting as well. It's a variety of factors around our students receiving services in their IEP. Alternate assessment participation, is the district over their 1% participation? That could be a factor. Are students receiving the related services that are in their IEP? So there are a multiple factors. Overrepresentation, of students of color in special education. A lot of demographic data like that. But I can certainly bring that information back to you and how we select, who, based on certain criteria, who's getting a desk monitoring, who's getting an on-site monitoring. I'll be happy, Ms. Hogan, to bring that back for y'all. I think that would be helpful.
All right, thank you. Mr. Davis, you're recognized by the chair. I'm asking that you limit your comments.
I just have a quick question. Miss Jordan, can I have an example of what you mean by a corrective action?
Sure, absolutely. I'll give you, this is just one example. So let's say that we received an issue that a school system was using, incorrect processes, or like we've seen that some school systems aren't even using the correct 504 plan for students with 504 students who qualify for 504. And so we would put them under corrective action for procedural and process issues. And so they would have to go back and they have to create a plan to address that. That first of all, I'm going to use the correct form that includes all of the accommodations and all of the supports that these students could potentially receive. So it could be a variety of things, Mr. Davis, regarding different compliance pieces. It could be that we found in a desk monitoring or an on-site review that there were no logs of related services. So we have students with IEPs that say they get related services, but we couldn't find any evidence of that. So they would go under corrective action and they would have to come up with a plan to get out of corrective action that satisfies certain pieces, right? That they properly document related services, stuff like that. So it could be a variety of different compliance issues, but I hope that gives you just a couple of examples.
It does, and it sounds to me like corrective action isn't so much as you're in trouble, you didn't do X, Y, and Z. You were giving them an opportunity to do X, Y, and Z, and there's no repercussions on them. I propose that, if you don't do certain stuff, then your system gets funding cut or whatever. But I know that's terrible, but stuff's got to happen. Like to tell them, hey, you did a bad thing, time out. So I know that's very elementary, but correct. The way I'm hearing it, corrective action is not punishing them for doing the incorrect things. In Section 504 plans, that's against the law, is it not? And they're doing illegal stuff. So, treat it as such. Don't just let them fix it and wash your hands with it. That's just that's how I feel. I mean, I had a 504 IEP and all that. And so that's how I was brought up, and that's my thoughts. And I yield my time back to the chair. I'm sorry, Ms. Jordan, but.
Thank you, Mr. Davis. Ms. Hyman, I see your hand. You're recognized by the chair. She can be the last hand. I'm gonna ask that you limit your questions or comments to at least 2 minutes.
I am. This is what I want to find out in that. Now, you kind of mentioned about cameras in classrooms and that. Does that, well, I know it works, but now for the classroom, how many of it feedbacks do classrooms kind of get? Do you ever get feedbacks from them?
We haven't received any specific feedback, negative or positive, about the cameras in special education classrooms. I know most of them, Ms. Heimel, this year really began to work with their council, and they focused on drafting their policy. They are also trying to find local dollars to support it. So like many school systems had already budgeted funds this year. And so that is kind of what we hear is around just the funding, finding the funding to support essentially these surveillance cameras. Now, based on the law, it's for self-contained classrooms only. So not every special education student, for example, that are in inclusive environments for the majority of the day, would that law apply, but it is specifically for self-contained classrooms. So for students with the most significant disabilities, and we understand, this is to protect those nonverbal students, right, who can't voice or tell you always. So, but I haven't heard, Ms. Heimel, any specific positive or negative feedback around it from school systems or classroom teachers.
Because, a lot even here that, they roll back on the cameras, even if it's not in the centers or whatever on classrooms. Do they ever use it even in homes as well?
I'm not aware. So the legislation is very specific and geared towards self-contained classrooms. So I'm not sure of any places where that's happening for like homebound settings or students being served at home, if that's what you're asking. I hope that answers that.
Okay. Thank you, Ms. Heimel. Thank you, Ms. Jordan. This is a very passionate conversation. Time well spent. We're going to go ahead and take this conversation offline. If you do, Ms. Jordan, for those who still have concerns, have your email address available, because this is something that has been a very enlightening conversation within the last 45 minutes. So
I'll drop my email in the chat.
Yes. So this report requires no action to be placed on file. We don't have any representation from the health services or financial for Medicaid. So we're going to bypass, we don't have a report nor a representative. So we're going to bypass that report. No, I'm sorry. We didn't have a report from, which one? Elderly Affairs.
Mr. Chair.
Ms. Zimmerman here. So I'm sorry?
We do have a report from Kelly Zimmerman for Bureau of Health Services Finance.
I'm sorry, I got confused. I was looking at the wrong part. Ms. Zimmerman, you're recognized by the floor. By the chair, you have the floor.
Hey, good afternoon, everybody. The report covers many things that you guys have already heard. You have heard some mention of the Ldh Business Plan. And so I did start the report with just a quick, really high level of the 4 commitments within the Ldh Business Plan, along with a link where you can read this for yourselves if you wanted to. But basically, the overall goals of the entire Ldh Business Plan would be to improve the health and well-being of Louisianans with emphasis on prevention, reshape the Ldh culture, enhance customer service partnerships and community relations, and to promote transparency, accountability, and compliance. And so a lot of the work that you guys are doing, and a lot of the work that we are doing really will sort of align and fall underneath these goals. And so I just wanted to share the high level, and the entire business plan is online at ldh.la.gov/businessplan. There is an item in the report that is specific to provider enrollment, and this is a reminder that all Medicaid providers have to enroll within the Medicaid provider portal system, which is a new requirement. However, that system is temporarily unavailable right now for some maintenance. And so we're going to let everyone know when that comes back online. The exciting news on the next item is that we did receive CMS approval to go ahead and implement our Act 421 or TEFRA. And so we have started accepting applications for this. And I think as of yesterday, we had 228 applications already. And so we appreciate your help and support in getting this started. We appreciate you guys helping us spread the word. And if anyone has questions about how to apply for that, the steps are outlined here in this report, but also on our website, ldh.la.gov/Act 421. A little small update on dental coverage within Medicaid and in several places. There are some things that we have to do behind the scenes to make sure that we are ready to implement dental coverage. And so we have on the waiver side, we have submitted the waiver amendments to CMS for approval. And then we are also working on some contract amendments on the dental contracts that we have. And so really working to move that forward and get everything in place in a timely manner. You guys have already heard about the American Rescue Plan Act. And again, we are still waiting on CMS approval. And as soon as we have it, we are going to share that information with you all. And then the rest of the information in this report is updates on numbers that we always share with you guys. So an update on permanent supportive housing, money file as a person, et cetera. And so all of these are in the report each quarter with updated numbers for you now in this current report. And that is it. I will turn it over for questions and I will do my best to answer.
All right. Thank you, Ms. Zimmerman. Do we have any questions or comments from the council? I'll see hands on my screen.
Yeah, I don't see any hands raised or any comments from Ms. Zimmerman.
Okay. And we don't have anything from public comment as well?
Sorry, what was that?
We don't have anything for public comment from Ms. Zimmerman's report?
No, sir.
Okay. Since there are no questions, no concerns, comments from either council members or the public, this report will be requires no action and will be placed on file. Next item of business is the Disability Rights of Louisiana. The chair recognizes Tori Roker for the report.
Okay, thank you. A lot of our report just details individual cases we've handled this time. So I don't want to go through summaries of the individual cases. What I'll basically do is just give an overview of the programs and just some of the highlights here. So one of our larger programs is our Community Living Ombudsman program. And we have trained ombudsmen who advocate for people with developmental disability who live in the state licensed privately run group homes across the state. And we had after the previous COVID surge, started to meet people in person again. A lot of our program had to go remote for safety during the first year and a half or so of the pandemic. We did start last summer trying to go in person again. We had to take that offline for a bit because of the Delta surge. And then we brought them back online, but now unfortunately we are in person after the Delta surge. We are temporarily, once again, monitoring facilities remotely because of the Omicron surge. We will be returning to in-person visits instead of remote visits once the current surge is over. Hopefully, that's the plan, because we do find that when we have people living in facilities and we have to help them and monitor them and make sure they're being treated properly, that in-person visits are much better than remote visits, and remote visits are really no substitute for in-person visits. We do work with the Attorney General's Medicaid fraud unit, and we have sent complaints to the Medicaid fraud unit, and we are recording resident complaints every month. Some of the complaints that we have received and lodged have been chemical restraints being used improperly for behavioral management, lack of informed written consent or approval by a specially constituted committee prior to administration of chemical restraints, staff verbally abusing residents, staff physically assaulting a client, and failing to conduct nursing assessments. So we do monitor facilities for things like that. We do find things like that, and we have been finding them and sending those complaints on to the proper state authorities. Examples of some of the things we're doing as far as people were helping. One of our ombudsman on her own and was being barred from visiting her husband. Our ombudsman dealt with that issue and corrected both those problems. That's just one example of the kind of work we've been doing. We also have a program that operates only in about 2 regions, well, 3 regions of the state. That does something similar to our ombudsman program that monitors people who are in facilities to protect their rights. We do try to monitor people who are using HCBS services to make sure they are not being mistreated. We again, with that, after the Delta surge began, in-person meetings again, and that is our supported independent living advocacy program. Unfortunately, we have had to go back to remote monitoring given the current surge. Just like with our program that monitors people in facilities, we will be returning to in-person monitoring as soon as it's safe. We of course were active in helping people after Hurricane Ida with that program, trying to make sure we stayed in contact with people and make sure they had things they needed post-hurricane. Also, we have a representative payee program. We are still operating. The program essentially provides oversight to representative payees and their services to beneficiaries. So for folks who are getting other people's Social Security benefit money and managing it, we oversee them to make sure they're not misusing the money, they're properly handling it, and they know how it has to be reported and taken care of. And we, through that program and also other programs, were actively involved after Hurricane Ida with the debacle involving the evacuation of Bob Dean's nursing homes. Our team in that program worked with our national organization to make sure that the beneficiaries have access to their conserved funds and their personal needs allowances. So our team was monitoring that, and we have been trying to get interviews with people in the nursing homes and conduct reviews of the nursing homes. So, and we do have, our legal team does have at least 1 or 2 clients who are in those nursing homes. And our legal team did open an investigation into that, and that's still pending right now. We haven't decided if we're going to bring litigation yet, in large part because there's so much private litigation. There may be no point in us bringing litigation from our agency, but We did open an investigation into the evacuation of the nursing homes to request information and to find out where the residents were located, because that was a big question. We didn't know where the residents were located, including the clients that we had in those nursing homes. Our FAIR program, this is an interesting program we have that helps the formerly incarcerated with disabilities find employment after incarceration, and also helps them find other resources they need to maintain things like housing and employment. And it's had a lot of success in the last couple of years. We have helped about 100 formerly incarcerated people with disabilities. And just over 51% of those clients, we found employment. We'll help them find employment. We've helped them increase their income. The numbers are in there. And after Hurricane Ida, that shifted over a bit towards making sure they had other resources they needed to try and maintain the progress they've made with employment and housing, and also whatever other things they might need. And that's really just the high points of the report. If you have any questions, I'd be happy to answer them.
All right, Mr. Roca, do we have any questions from the council members in regards to the report from Disability Rights of Louisiana?
We have 3 hands raised, Mr. Logan Davis, Dr. McKee, and Ms. Jill.
Okay. Mr. Davis, you're recognized by the chair. You have the floor.
Okay, and I'll be brief. And Mr. Roca, I shot you my personal information. Did you get it?
Is it in the chat? I wasn't even looking. So if it's in the chat, I wasn't looking. Let me put my my email in there so you can see it.
I sent you a direct message in the chat box.
Okay, I did not see it. I was probably because I was presenting, so I did not see it. Oh, I see it right there. I see it now.
Okay. We'll just talk offline because I don't want to waste any more time. But yes. Yeah. Okay.
Okay. Mr. Anderson, who was the next hand that you saw?
Dr. McKee.
Okay, Dr. McKee, you're recognized by the chair. You have the floor.
Thank you, Mr. Chair. Mr. Roca, thank you so much for your report. I wanted to get more information on that CAP program, and you highlight that. That's something I think maybe the council might want to be interested in, and I wanted to get more information on that. And then I also wanted to make note that I know we're trying to save time, but I think we may be required to read some of the public comments that's in the chat because it is for public record. So I just wanted to keep the council abreast of that. Also, that's it.
Okay. In terms of more information, would you like my report next time to focus more on our CAP program? Get some more information.
Yeah, I mean, it seems like it's really good stuff, good work, you know, I believe. And I mean, if you could just kind of maybe say 20 seconds about it, because I think you kind of glossed over it.
I probably did, frankly, because I'm basing this report on a lot of what our the director who manages that part of our agency wrote, and she didn't have a lot to write about it this time around. So I'll be honest with you, this report is in part cannibalized from a report somebody else wrote inside my agency. So and that's about what she'd written about it. I could say a little about it, where we just hired a new manager in that program. So we're focusing on that program as much as we have been. I think we hired another advocate too, and a new manager. So we'll be developing that more. I'd probably be better if I focused a little more next time on it, because I honestly don't have that much more to say about what CAP's been doing in the last few months, because that's frankly, the director of that department knows more about it than I do.
Thank you, Mr. Roca. That's okay. Next time we'll hear more about it. Thank you.
All right. Ms. Hayno, I see your hand. You're recognized by the chair. You have the floor.
Okay, this is kind of gonna piggyback off Dr. McKee in the sense of requesting information, but we had some horrifying discussion about restraint in the school systems, and I know that your case studies you show us is more geared toward abusing group homes, but do you have any cases? By the way, I love like that cases are on here because I love to read them. That's my do you have anything specific to restraints in the actual school system, or is are your reports more geared toward group home facilities?
So I don't think I have any right now. I don't have any specific things to report around about restraints outside of group homes. We do, however, monitor HCBS like we monitor group homes. Unfortunately, our program for doing that is actually limited and small. It only covers the Baton Rouge area and Orleans Parish and Jefferson Parish, simply because we're only funded for that. We have wanted to expand that program for a while and get more funds to actually cover the whole state. But right now, our main focus, or just because of funding and the resources we have, does cover facilities, not HCBS situations. And in terms of other improper restraint things we handle, it would also be in schools too, but of course only if reported to us. We don't really go in and actively monitor schools. So
okay,
the broadest scope of our monitoring for improper restraints would be in things like ICFDDs. We do monitor HCBS for that too, but the scope of our program is much more limited, and we do handle those issues in the schools, but only when reported to us, because we simply don't have the resources, or I think even a mandate to go inside schools and constantly monitor them.
All right. Okay, just so I know, so that restraint is literally a hot topic today. Just for clarity, so Ms. Jordan, Ellen would provide more school-based data, and you would provide more, I see, the intermediate care facility data. Okay. I mean, okay, that's all. And I asked because I like to check around with our hot topics issues every quarter, and I think Dr. Wilson kind of cleared it up to check. Do y'all still offer benefit planning as an initiative?
Pardon me, was there was there another question? I didn't quite get it.
Do y'all still deal with benefit planning, or is that strictly Ldh's for the state?
We do have so in terms of benefits planning, our Rep Payee program that I mentioned It's sort of like benefits planning because it actually monitors people who are managing benefits for people. In terms of the program that Lighthouse now manages, we call that WIPA. We do that.
Yeah, WIPA.
Because of federal changes, though, we are now handling that program for a portion of the state of Texas. The federal government decided to change some of the standards by which it awarded these programs in the last year or so, and that is why Lighthouse has the portion of the Louisiana contract that we used to have, and now we are managing a portion of Texas. Is just how that worked out with federal changes. So. It looks like I think Dr. Wilson and Lighthouse are who you would go to for that. Unless you move to Texas, then you might be able to help.
Then I'll call you. All right. Thank y'all.
Thank you.
You're muted, Mr. Bristow.
Oh, I'm sorry, I'm muted. I've been talking the entire time. I don't see any other hands raised. Am I overlooking anybody?
Rosalind did have her hand raised, and then it looks like she got off and then back on. So I don't know if she still had her question. And then Ms. Bambi Polizzola has her hand raised.
Okay. Ms. Polizzola, you're recognized by the chair. You have the floor.
Are we on new business?
No, ma'am, not yet. We're still entertaining the report that was presented by Disability Rights of Louisiana. We haven't put the report on as of yet.
Okay, I have new business. I'll wait.
Okay. Ms. Heimer, I see your hand. You're recognized by the chair.
Thank you. I just got kicked off. That's why. Yeah. I want to know. I read it on your report, and that for Delgado is for adults, and that for like GEDs, and that does that help out with anything like for adults for programs, if sometime down in the future, like if you could pull up the report again where I saw that. You muted.
Are you referring to the part of the report where we mentioned helping get people the support they need to get his GED? So we don't have any GED program within the organization, but this was helping provide somebody the resources they need and to get their GED. So we don't have a GED.
That is the one that I am referring to. Yes.
We do not have anything like a GED training program within the organization. This is more, but the program that's was mentioned in that part of the report is the program that specifically helps people who were formerly incarcerated with employment and other things they need to find employment and maintain employment.
Well, that's what I was trying to see into that, because I couldn't read it all, but what is that specifically to help adults, in the future? Like, I mean, to get, does that mean to get like jobs or something like that?
Actually, it is those specific to people who were formerly incarcerated. So that is a specific program we have that was created by one of our managers about 4 years ago or so. She just invented the program herself and sought funding for it through independent organizations that fund things like this. And the crux of the program is that It's for people who are formerly incarcerated who have disabilities, helping them find stable long-term employment and helping them find other resources they need to help maintain that employment. So that is specific to people who were formerly incarcerated.
Oh, okay, that's what I'm looking at. It's what I'm looking for. I do appreciate that.
What is the name of that program again, Mr. Roca?
It is called FAIR, F-A-I-R, and I will have to look up what that stands for. It's in the report, but what does that stand for?
Okay.
It is our financial
I'm sorry.
It's our Financial Access, Inclusion, and Resources Program, FAIR.
Can you spell that word again, please? I'll appreciate it.
F as in Frank, A-I-R.
Is it F-A-I-R?
It is.
Okay, thank you.
Do we have any other comment, questions in regards to the report that was presented by Disability Rights Louisiana?
I don't see any hands raised. You did have someone specifically for Mr. Roca put his email in the chat.
Okay.
I'll do that.
All right, Mr. Roca. If there's no other comments from the council or any public comment, this report will be placed on file. It requires no action to be placed on file. Due to the restraints of time, we're going to bypass the recess and we're going to go into transition. Do we have any business, Ms. Polazola? You had your hand raised. You're recognized by the chair.
Yes, I just wanted to make the motion.
Bambi, can you kind of fix your sound to your tablet?
Yeah, I'm trying to find it. Sorry. Can y'all hear me? Can you hear me?
Yeah, that's better.
Yes, we can hear you. That's better.
Okay, I make a motion for the executive director to have the decision-making authority to allow LaCan to participate in in-person activities with the expectation that relevant public health information is considered and LaCan staff have the ability to make personal choices to not to participate in in-person activities. And the reason why I say that is we won't meet for another 3 months, but the legislature will start in about the regular session will start in about 6 or 7 weeks. And so I don't want to tie the hands of the ability for our LaCan leaders to be able to advocate in the way that they need to. So this will give that option for them to be able to have in person if it's safe to do so, and the executive director decides that.
Okay, so we have a motion on the floor presented by Ms. Bambi Polazola to give the executive director to making the authority to allow LaCan to participate in in-person activities with the expectations that's relevant public health information is considered, and LaCan staff have the ability to make personal choices to or not to participate in in-person activities. We have a motion on the floor.
I second that.
It's been moved by Ms. Bambi Polazola. It's been seconded by Dr. Hyde McKee. Now we have time for question.
What do you mean by the proper public health? Let me find it. What expectations is she referring to when she says, or when Mammy says something about the public health information and the LaCan staff have the ability to make personal choices to not participate in in-person activities?
I'll let Ms. Polazola elaborate for you. or Mr. Davis, because I know you're a new council member, and there may be some things that once you have a full grasp of what you're about to vote on.
So the public health information would be any recommendations from our public health officials on the safety of interacting in person. So should take all of those things into consideration. And then the other part in regards to allowing, just allowing people to make personal choices. We don't want to, we don't know everyone's health condition or, that, so they have to make personal choices for their own safety. And so this would just allow people to not be forced to do anything that they don't want to do.
Okay, and can you remind me what LCAN stands for? Because I thought we had a thing about abbreviations.
LCAN is the Louisiana Council Advocacy Network, so it's our advocacy network. They do legislative advocacy and policy advocacy on behalf of the council.
Okay.
Do we have any other question in regards to the motion that's on the floor that has been moved in second?
Ms. Hayno, hand raised.
Okay, thank you. Ms. Hayno, you're recognized by the chair.
Oh, I'm so sorry. This is something not, this is not pertaining to the motion, so I will wait.
Yes, if you will table that until after, because we have a live motion on the floor, so anything non-relevant to the discussion at hand, I'm gonna ask that you table it until we come back to it, okay?
What's the motion again? Can you remind me again or remind us again, please?
In summation, the motion is by Ms. Bambi Polozola she makes a motion for the executive director, Ms. Amy DeVille, to have the decision-making authority to allow LCAN to participate in in-person activities with exceptions that relevant public health information is considered and LCAN staff had the ability to make personal choices to not participate in or person activities.
I have a argument. Would that at the same time be moot because you're allowing the executive director, Ms. Amy DeVille, to make decisions, but then again you have the governor say, hey, we're not doing all this, and so wouldn't that be moot? And then the CAN staff have the ability to make personal choices to not attend for their own personal health. So what's the purpose of doing that in the first place? I mean, I'm just asking questions.
Oh, and this is why you ask the questions, because this is a very serious discussion that we're talking about. So,
I mean, we've already had Delta and Omicron, and I mean, are we waiting for Optimus Prime? Or I mean, just I'm being sarcastic, but at the same time, I'm being serious.
that's why, like I said, that's why this vote is. And when it comes down to the decision that you make, the way that you vote will determine if this is something that will take place, Mr. Davis, or not.
Well, I vote no.
Okay, just pause until it's time for the actual vote. We haven't called the vote yet. We do have this, we're just at discussion at the moment. That way everyone can have a clear understanding about what we're voting on. That way after the vote has been made, there's not going to be any redacting. So that's why I want everyone to make sure they're understanding what's going on. Ms. Heimel, I see your hand. You're recognized by the chair. You have the floor. Then Dr. McKee.
Yes, I do. This is what I'm thinking, and I'm looking at it. Can we really word it differently than for what we have it now? Because what I'm thinking and I'm really feeling, the LA can, I feel like this, that they should have some kind of say in as well to get their input And this is how I feel about it.
I'm gonna open it up for a public comment just as soon as we get through discussing amongst the council members. So I haven't dismissed that, but we'll open it up for public comment. I just want to remind everyone.
So could we ever change the wording?
Based upon the public comment, or do you want to present another motion?
Well, we could keep it like this, but can we just change the wording? I mean, this one, to me, could we change the motion a little bit?
You have to go with what's been presented in second at the moment, but then if it dies, then we can change the language of the.
Yeah, that's what I'm looking for, the
language
language.
change.
Yeah, that's what I'm trying to say.
Yes, ma'am.
Yes.
For clarity, we have to entertain the motion, and unless the initial person who's Ms. Pozo who wants to change the language, but it's moved in second, and now we're up to discussion. Also, Dr. McKee, I see your hand. You're recognized by the chair.
Thank you, Mr. Chair. I actually don't see any problems with the wording. I think that the last sentence clearly says that the staff has the ability to make personal choices to not participate in in-person activities. I think the motion is just asking that the executive director to have the decision making to allow the, to have the authority. But the motion does not say that the staff does not have personal choices. So I'm understanding that the motion is written the way it was intended, and I don't see any problems with the motion as the way it's written. It still allows the individual staff to make personal choices to not participate in in-person activities, and that is keeping the public health information under consideration when those choices are being made. Just allows the executive director to have the decision-making authority. So I hope that brings clarity to the motion. I don't see where the wording of the motion needs to be changed.
Right, thank you, Dr. McKee. Do we have any other council members with questions before we move to public comment?
Yes, I do, Chair.
Okay, Mr. Davis, you're recognized by the chair. You have the floor.
I am going in part by my personal thoughts and the public's feedback in the chat. Personally, it is written that the LACAN staff have the ability to make personal choices to not participate in in-person activities, but say they do, and then they spread whatever comes next around the state. What happens then? Who is held liable? It's just, and then the public says, Vivian Webb said, I agree, going in person isn't a very good idea as it puts people's health at risk as the employer for local and personal safety is, yeah. So, I mean, are the legislators, do they take any precautions like wearing masks? Or are they doing this? Or are they doing that?
Good question, Mr. Davis. Hold that thought for just a minute. Mr. Andrews, if you will, go ahead and read the public comment. That way we can have it on record.
For this particular issue?
For this particular issue, please.
Okay, so Ms. Susan Reen says, so LACAN leaders would still be able to choose according to their health issues, etc. Let's see. Ms. Kathy Dwyer says, exactly, Susan, many legislators do not wear masks and can put others at risk, especially those in an at-risk group. Mr. Logan Davis agreed with Kathy. Vivian Webb also said, I agree, going in person isn't a very good idea as it puts people's health at risk. Mr. Davis, there should not even be an option to do this. Melinda Elliott says, I agree, Logan. Ms. Susan Reen says, as the employer for the LACAN leaders, personal safety is my concern for all leaders.
For all leaders. So is it just limited to leaders, not everyone else, like not the public safety, public at large, just the leaders?
The question directed to the chair, Mr. Davis.
I'm sorry, Chair.
No, I'm asking, are you asking the chair, or are you just making additional comment to the comments that have been made by public?
My question was directed at the chair and at Vivian Webb, because she was asked the one. No, was it? I don't know. No, it was Susan. I can't pronounce her last name.
Susan Reen.
That's it.
I could probably shed some light on at least some background on Susan's comment. Just as the employer for LeCan, so we do contract with Families Helping Families in Southwest Louisiana for the LeCan contract. But Susan Reen is actually the employer of the LeCan leaders. Technically, they are supervised by her because she holds the contract and employs them to fulfill that contract on behalf of the council. So I just wanted to clarify that and also let you know there are a few more comments in the chat about this, and you do have 3 hands raised from the public.
Okay. Who do we have from the public?
You have Charles Michel, Christy Curtis, and Kathy Dwyer.
Okay. In that order, Mr. Michel, you're recognized by the chair. You have the floor.
Thank you. Can y'all hear me? Can you hear me?
Yes, sir.
Yes, sir.
Okay, great. Just real briefly, I view this motion as a means to be proactive instead of reactive, because I know like last year and maybe even the year before, we weren't allowed to make the visits. It was mandated that there could be no visits. If things get better and people are comfortable doing it, this will allow the LeCan staff to make the choice. They're not in any way forced to go, but it gives them the opportunity. I know for the last 2 years, we've had a lot of difficulty getting meetings with legislators because we couldn't go over there and they had no time to meet with us. In Region 3 specifically, this will give us the opportunity, if the LeCan staff member chooses to do it, to have better representation as we're trying to advocate for those, for the things on our agenda. So I think this is just being proactive. It doesn't force anyone to do anything. And if anyone chooses to go and they get sick, that's basically a risk they're willing to take. I'm not going to mandate that they go, and I don't want to mandate that they don't go. So I just think this is a proactive measure. Thank you.
For those comments, Ms. Andrews, who was the next hand that you saw?
Ms. Christy Curtis.
Mr. Curtis, you're recognized by the chair. You have the floor.
Thank you, Chair. So I am the LeCan leader for Region 4, and I don't speak for all leaders, but there are quite a few of us that would like to make the choice to attend in-person events on our own, even if there is some kind of contract or something that we need to sign, some release. I think it needs to be pointed out that my outreach for LeCan is falling behind. The only form of outreach I have is email and social media. And I am very active on social media for LeCan. I'm still not able to connect with groups like Autism Society of Acadiana, who is only holding in-person activities. Now, I have a son with a deficient immune system. So I'm well aware there are health risks, and I am keeping the social distance. I wear a mask. I'm taking all precautions. I have had my COVID vaccines. I've done everything that I'm supposed to do, that I've been asked to do by the governor. I would like to make that choice for myself so I can continue my outreach and connect with our members and self-advocates. Also, many of there are quite a few meetings that have been scheduled that I've been able to schedule virtually. Many of our representatives and senators want to meet virtually instead of in person. Maybe if I was able to meet in person, I can schedule with other legislators. I'm not sure. I would just really like to make that choice for myself. Thank you.
All right, thank you for those. Mr. Andrews, who do we have next?
Ms. Kathy Dwyer.
Ms. Kathy Dwyer, you're recognized by the chair. You have the floor.
Thank you, Mr. Chair. I'm really torn by this one. I understand the importance of outreach. I understand a lot of people care and, and are concerned about everyone's safety. Are familiar with all the guidelines and may actively use all the guidelines and then some. The problem is you can be asymptomatic with COVID and still spread it. And that's where my concern, and I'm going to say, because I have been home with my daughter for almost 2 years now. It's going on 21 months, I think. I want my life and my daughter's life to get back to normal, but her day hab isn't open yet because it keeps spreading in the day hab. I can't let people come in because this keeps spreading because my daughter's at risk. Every time we ease up on something, there's a surge. And that sets us back even more. And people seem to be forgetting about my daughter and me, who are sitting home 20 plus months without any services or real activities, even though we try to go out where it's safe, where the crowds aren't large. I'm just, excuse me if I'm expressing some frustration, but I am very frustrated. I just think we're never going to get to a safe place where we can go out safely. And those, and I say we, those that are at high risk and participate in community like we're supposed to do. My daughter has every right, every constitutional right to participate in society. But she can't because others are going about freely, whether they're practicing mask wearing and social distancing or not, and spreading a highly contagious virus because they're asymptomatic. So I'm not sure where this motion is going. I'm not sure what Bambi's intent was, other than maybe to give people personal choices, but it's people's personal choices who have interfered with my daughter and I having our real lives back. Thank you, Mr. Chair.
All right, thank you for your comments, Ms. Dwyer. Mr. Andrews, do we have any other comments from the public?
Yes, you have a hand raised from Katie Crows, and you have a few comments in the chat.
Okay, Ms. Katie Crows, you're recognized by the chair. You have the floor.
Yes, thank you, Chair. As the LeCan leader for Region 2, I just want to voice the same opinion as Christy Curtis did, which is that those of us like myself who are vaccinated, boosted, wearing masks and social distancing and doing all the things that we can do, I would like to be able to conduct outreach to my representatives and centers. It's very important to my job. And those who are willing to meet with me, I would like to be able to join in those meetings to do legislative outreach as I'm part of my contract to do so. So thank you.
Thank you for those comments. We have public comments in the chat. Ms. Andrews.
Sorry, I was muted. Yeah, you do have some in the chat and a few other hands that you want me to handle the chat first?
Yes, please read the comments in the chat for the record relevant to the topic, and then we'll go to the hands that are raised.
Okay, so Ms. Vivian Webb says, even if people are wearing masks and social distancing, it's still not a good idea. Omicron is very catchy, and more people going in person will help COVID-19 spread, thus endangering people. Susan Reen, I believe this was in response to a question Mr. Davis had. She said, looking at leaders, their families, their co-workers. Kathy Dwyer agrees with Vivian's statement. Let's see. Katie Crows, she said that she agreed with Christy. Julie False says everything Christy is saying is happening in Region 3. I would like the choice. Logan Davis says, Christy, you can't assume that everyone else has gotten the vaccine. Threat. He also said that Ms. Kathy had a good point. You can be asymptomatic. Ms. Corley says that's correct. I strongly agree with Ms. Dwyer. Vivian Webb says making that choice yourself may still pose risks to you, your families, and everyone you encounter. Long-term COVID is serious too, and it comes back. And your first time may not be as bad as the next. I know why people want things to go back to normal, but it isn't safe. Before we start letting things go back to normal, the numbers need to go down enough for it to be safe. Rosalind Heimel says that she agrees. Mr. Harlan Kauser says, I don't think we are collectively doing enough to control the virus. Ms. Kathy Dwyer says outreach can be conducted in other ways. We have been doing it since the pandemic. That's it for what's in the chat about this topic. Next, well, you do have a council member. Ms. Jill Hano has her hand raised.
Okay, Ms. Hano, you're recognized by the chair. You have the floor.
For me, and I agree with everything everyone's saying, but for me, the main point that sticks out is that I wholeheartedly agree with Bambi because it should be personal choice. And y'all, like, okay, and this is what I don't understand is if it's right now in my pea brain, we're talking about personal choice. So if your personal choice is not to go, then stay home. Like everyone I love has had COVID, and I am doing whatever I can not to have COVID. I am determined not to get COVID. Rashad, as you already know, COVID interfered with my Christmas. Okay, but I think I'm gonna stop because I'm kind of in the wrong. So never mind.
Thank you. Do we have any other public comment?
You have 2 hands raised and a few more chats.
Okay, we're gonna have, we have an issue at the moment. The issue in the discussion at hand now, the issue is, looks like we're losing our quorum.
Mr. Chair.
Mr. Davis.
Can we go ahead and just vote on this? Because it sounds like we're just going in circles.
The way it's looking,
I'd like to call the question.
1 minute, Dr. McKee. Let me reassess something. From what I'm counting, looks like
I didn't
we lost
say
our
anything.
quorum.
That wasn't Dr.
Oh, I'm
McKee.
sorry.
That was.
Who was that
Ms.
that just acknowledged the
Basile.
chair?
It was Kim Bazile.
Okay. 1 second, Ms. Bazile. Let me see, do we have a quorum still? Is Ms. Jenkins, are you still there?
Yes, sir, I'm here.
I can't see all the screen at one time. Do we still have a
I'm
quorum?
sorry, y'all.
Okay, we just got quorum. We have 13 now.
Okay, we have a quorum. Okay, Ms. Bazile.
I'd like to call the question.
Okay, we have a quorum. The question has been called. At this point, we'll have a roll call vote. This will require 2/3 vote. So we'll have a roll call vote. Ms. DeVille?
Mr. Andrews, could you do the roll call vote, please?
Sure. So is this are you doing it for calling the question? Is that what this is?
This is for calling the question.
Okay. Ms. Banks?
I'm sorry, point of order. I do apologize. Ms. Bazil's motion requires a second before you move to a roll call vote.
Okay, thank you for the point of order. So we have.
Bill, I will second the motion.
Okay, I did not, can you identify who that was? I heard the voice, but I didn't see it on my screen.
That was Dr. Philip Wilson.
Okay. It's been called a question, it's been seconded by Dr. Wilson. Please proceed.
Ms. Banks?
Yes.
Dr. Baravecchio? I'm sorry, Ms. Banks, yes. Dr. Baravecchio, I don't know if she's still on. Ms. Bazile?
I'm sorry, Brenton, but can you explain to the council what they're voting on, yes or no, and how?
A yes vote would end this discussion for this particular motion. A no vote would continue the discussion.
Thank you. Yes.
Ms. Bazile, yes. Ms. Bayham? Ms. Kose? Ms. Crane? Mr. Davis?
Question. So yes vote would end the discussion, not the motion at hand, correct?
Correct.
Correct.
Then yes, I vote to end the discussion.
Mr. Davis, yes. Ms. Eagle? Ms. Gonzalez? Ms. Guidry?
Yes.
Ms. Hagan? Ms. Hano?
I'm sorry, if you were calling Hogan, Kimona Hogan, yes.
I'm sorry, it was Hagan, Ms. Julie Hagan. Ms. Hano?
Yes.
Ms. Hano, yes. Ms. Harmon?
Yes.
Ms. Harmon, yes. Ms. Hogan?
I'm sorry, yes.
Ms. Hogan, yes. Ms. Heimel?
Yes.
Ms. Heimel, yes. Mr. Iddens?
Yes.
Mr. Iddens, yes. Dr. McKee?
Yes.
Dr. McKee, yes. Ms. Polizzola? Mr. Roca?
Yes.
Mr. Roca, yes. Mr. Rivera?
Yes.
Mr. Rivera, yes. Ms. Tarver? Ms. Webb?
Yes.
Ms. Webb, yes. Ms. White? Dr. Wilson?
Yes.
Dr. Wilson, yes. That is 14 yeas, 0 nays.
Now, we will entertain the motion that is on the floor by, we go directly to the vote of the motion that was on the floor by Ms. Bambi Polizzola. I repeat the motion, to make a motion for the executive director to have a decision-making authority to allow LeCan to participate in in-person activities with expectations that relevant public health information is considered and LeCan staff have the ability to make the personal choices to participate in in-person activities. It was seconded by Dr. McKee. So now we'll have a roll call vote on this motion. Mr. Andrews, if you please.
Ms. Banks?
Yes.
Dr. Baravecchio, Ms. Bazile,
Yes.
Ms. Bayham, Ms. Kosei, Ms. Crane, Mr. Davis,
No.
Mr. Davis, no. Ms. Eagley, Ms. Gonzalez, Ms. Guidry,
Yes.
Ms. Julie Hagan, Ms. Hayno,
Yes.
Ms. Harmon,
Yes.
Ms. Kimona Hogan,
Yes.
Ms. Heimel, Ms. Heimel,
Yes.
Mr. Iddens.
Yes.
I'm sorry, what was that?
Yes.
Yes, gotcha. Dr. McKee?
Yes.
Yes. Ms. Polizzola?
Yes.
Mr. Roca?
Yes.
Mr. Rivera?
Yes.
Ms. Tarver? Ms. Webb?
No.
No. Ms. White? Dr. Wilson?
Yes.
You have 13 yeas, 2 nays.
I have a question, Chair.
Ms. Kosei abstains.
Over just a moment. Did you recognize Ms. Kosei or Mr. Andrews?
Ms. Kosei abstains. That would be 13 yeas, 2 nays, and 1 abstention.
Motion passes. Thank you very much. Mr. Davis, you're recognized by the chair. You have the floor.
My point is moot.
Let me preface this. A vote has just taken place. If this is about that discussion, unfortunately, we can no longer discuss it because the vote is
That's why I
already.
said it was moot. Oh, sorry. Thought it was moot. Yeah.
So is it in regard to what we just voted on?
It's moot. Drop it. I'm dropping it.
Yes, sir. Okay. Ms. Brenda Kosei, I see your hand. Okay, so do we have any announcements?
Mr. Chair, it looks like Jill Hayno has her hand raised.
Oh, I apologize. Thank you. Ms. Hayno, you're recognized by the chair. You have the floor.
I think that was a mistake.
Can you repeat that, Miss Hayno?
I didn't mean to have. I don't know why it was up.
Okay, it was an accident.
Yes.
Okay, not a problem. So now we're up to announcements. Next meeting is going to be on April 21st, 2022. Do we have any other announcements from any other council members?
Excuse me, though, Chairman, are we ending right now as we speaking?
Yes, ma'am. We're getting ready to adjourn. Our business has been taken care of. We've had our reports that have been presented by our council, and we also have our announcements. But before you say anything, I just want to say you are up next. I was about to recognize you. Thank you for your time and your service to the DD Council. You're going to be greatly missed. You've been a great contributing factor to the DD Council. And just because you're rolling off does not mean that you don't have to make yourself available, and you still can, you're still an asset in any capacity, whether you're a council member or whether you're in the public.
Still,
You're muted.
You're muted, Ms. Hyman.
Yeah, but like I'm saying, could I still be a part of it, or what could I really do to be a part of it? Because this is my passion, and I really want to thank everybody for it, for giving me this opportunity to be on the council.
Still a lot of things that you can do to be a contributing factor to the council. Just because you're not a council member does not mean that you still can't be in attendance of any public meetings, or be able to be a voice and still be boots on the ground to let us know what's going on in the community. So we thank you for your service, and we're looking forward to seeing you in the near future. One more thing I want to address. This has happened with the previous chair, and I noticed that it happened with me last month. Periodically, the council will receive a fraudulent email that says it's from the DD chair. If you ever receive an email and you're questioning if it is me, two things are going to be identified. One, I'm going to put what I want in the subject, and two, in the body, I'll have my personal phone number. That way you can verify that it's actually me and it's not fraudulent. I don't want anyone to be taken advantage of anymore, where someone is trying to ask me, where I'm saying I'm in a meeting and I need you to handle something privately for me. So if you receive anything moving forward, if you don't see my phone number attached to it, then it's a fraudulent email. Just let us know so we can go ahead and let everybody else know. Do we have any other further business to discuss before we adjourn?
There is a comment in the chat from Ms. Rhonda Corley.
Okay.
She said, question, can the DDC have a representative attend the Bessie and seat meetings and speak on behalf of the DDC? And Ms. Banks, I think, is asking a question related to that. When and where are the meetings?
Do we have a representative?
I don't think we currently do.
Okay. Since that's been proposed to us by the public, we'll make sure that we'll find out how we can start making that fluent with that possibility. Do we have any other further business to discuss? Do we have any other comments? Do we have anything in the chat?
I have a question.
Okay. Ms. Hannah, the chair, you have the floor.
Thank you. Ms. Deville, did you say you were either this week or you still have to meet with the legislator for the camera bill?
We met 2 days ago.
Oh, okay, because I was just like impressed with we had some very good conversation about the camera bill, and I didn't know if y'all had met, but I was, if not, I was hoping to get that you had all this in your notes to forward to him, but just the first thought. Thank you. Thanks anyway.
All right. I didn't mean to raise my hand. Okay. Do we have any other comments in the chat, Mr. Anders?
Hey, I'm sorry. I froze and logged back on. I don't see any, Ms. Rhonda Corley, she also has her hand raised. That she, as to answer Ms. Banks' question, Bessie and Seat are held at the Claiborne Building in Baton Rouge. Bessie meets 2 days a month. And I do know those schedules are usually published on the Bessie or Board of Elementary Secondary Education website.
Okay. You said Ms. Corley had her hand raised?
Yes, as well as Ms. Kathy Dwyer.
Okay, Ms. Corley, you're recognized by the chair.
Thank you so much. I'm actually currently driving, so that was why it was taking me so long to respond to you. But currently, we don't have any representation at anything that is very pertinent for the disabilities community. The DD Council actually have many seats on me.
Your card breaks down.
I'm sorry. The DD Council have many seats on many boards, and we currently don't have any parents of individuals with disabilities on those boards. And we are currently, and our voices are actually being. So we really need to have the representation there at those meetings. Bessie meets 2 consecutive days in a month. They just met Tuesday and Wednesday. Their next meeting is next month, and Seat meets every 2 to 3 months, and both of them have their meetings scheduled. The schedule is actually posted on Bessie's board in the board doc, and Seat's schedule is.
Okay. Ms. Corley, sound like you keep losing you.
You keep losing me because parents keep calling me. I apologize for that. But I just wanted to make sure that that the council know that we really need representation. When Mr. Fleming was our deputy director, he was always at every single one of those meetings, whether it was Bessie's seat, the board that deals with discipline, etc. He was at every board meeting, and he always spoke on behalf of our DD Council, as well as we had parents on each and every last one of those boards. And right now, it is not happening, and we really need that representation. I am one person, and it is hard for me to be 50 million places at one time. So I just really and truly ask that you make that a priority, because one of the things is our DD Council staff is actually supposed to attend some of these meetings, and they're not being there neither because they're working from home. And I do understand that COVID is a reality, but also making sure that the DD Council is represented is important as well. So thank you so much.
Thank you, Ms. Corley. And I have a meeting. I'll get with the executive director in regards to your request. Ms. Kathy Dwyer, you had your hand up. You're recognized by the chair.
Thank you, Mr. Chair. I believe I had asked this at one of the last meetings. I can't remember if it was the absolute last one or one before, but I received DD Council emails about several events, and I would like to ask that you also send out email announcements about DD Council meetings as well as the committee meetings. I understand they're on the website, but you have to stop and remember to go to the website to look to see when they're scheduled after they're posted. And I think it would be, you would get more people participating, which in the public should have the right to know that they're happening if an email announcement was sent out a week or two before the first meeting.
Thank you for that. Do we have any other business or any comments from public or council members?
Like you have a couple of comments in the chat. I think a lot of this may have been answered. Yeah, Miss Kathy was asking about email announcements, which she just covered. Miss Christy Curtis did say LeCan leaders usually attend these meetings. She's referencing Bessie and Seat. And they have been attending those virtually since there was in-person suspensions. And then Ebony Haven, she posted the schedule, the Bessie schedule from Ms. Banks.
Thank you for that. I don't see any more hands raised. We don't have any more comments from the public, just to be clear. That's all, Ms. Anderson?
Yeah, I don't see anything, Mr. Chair.
Okay, we're hearing no objection. This meeting is now adjourned.
Okay, bye.
Let me get this last part. Let me get this last part of the link.